House Finance Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04 as extended, this public body is authorized to meet electronically. Please note there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. However, in accordance with the emergency order, I'm confirming several things. We are A, providing public access to the meeting by telephone and with additional access possibilities by video or other electronic means. We're using the Zoom video webinar for this remote meeting. All members of the committee and the staff of the state agencies with agenda items have the ability to communicate contemporaneously during the meeting through this platform, and the public has access to contemporaneously watch and or listen to the meeting on Zoom or phone following the directions and links provided in the House calendars starting at House Calendar 8 going through the current version 12. B, that this group is providing public notice of necessary information for accessing the meeting. We previously gave notice to the public of the necessary information for accessing the meeting telephonically. Instructions have been provided in the House calendar. C, providing a mechanism for the public to alert the public body, let us know, in other words, during the meeting, if there are problems with access. If anyone has a problem, please email the following email address, lba_fiscal, FISCAL, at leg.state.newhampshire.us. In the event that the public is unable to access the meeting, we'll go ahead and adjourn and reschedule. I don't anticipate any votes today, but any votes taken shall be done by a roll call. So we're going to start here with the roll call in a minute. I want to let you know that Representative Rogers is going to have to step away at around 10 o'clock for maybe as much as an hour. I would like to do a recess from around 10 minutes after 11 to noon. Think about that, and if anyone has a problem with that, let me know before we get to the recess point. Okay, so let's start the meeting by taking a roll call attendance. When each member states their presence, please also state whether there is anyone in the room with you during this meeting, and that's required under our right to know law. So Mr. Clerk, could you take the attendance, please?
Representative Earth.
Present, alone in my home office.
Representative Weiler, I'm alone in this room in Kingston. There are others in the house. Representative Bean.
I'm in Guilford in my home. My wife is in and out.
Representative Wallner.
I'm at home in my home in Concord, and my husband is in the house.
Representative Nordgren.
I'm alone in my dining room at my house in Hanover.
Representative Rogers.
I am alone in my apartment in Concord with my dog.
Representative Edwards.
I'm alone in my home office in Auburn. My wife may walk in to refill my coffee.
All members present.
Thank you so much. So the big news from last meeting is that Mr. Ripple was able to get the recordings of our previous meetings up online. They're at the Division 3 webpage. If for any reason you have a need to go take a look at something that was actually said during one of our prior meetings. So that's new news. With that, I think, Mr. Ripple, we're ready for Ms. Santinello.
Yes. So I'll bring Karen and Chris Santinello, and I think Rebecca Lorden will be joining us.
Morning, Ms. Rounds.
Good morning.
Thank you for having Mr. Williams call me and educate me yesterday about the RSA. I now know the Commissioner has great authority to reconstitute his agency however he sees fit or she sees fit, so thank you.
You're very welcome. John is the knowledge bank of the department when it comes to statutes, so happy that he could help you out. So I'm going to turn things over to Chris, and you're also meeting a new finance director today, Rebecca Lorden, not new to the department, just new to you face-wise. She covers DEHS as well as DCYF, so you will see her today and again next week. So Chris, I'll
Where
turn
she
it-
is.
I'm
She's on
sorry?
a beach. I want to be where she is. She's on a beach.
Actually, I want to be where you are for someone to refill my coffee, but that's okay. So I was really jealous. So, my name is Chris Santinello, and can you hear me okay? I've been having sound difficulty, so I'm going to try to wear my headset all day today. My name is Chris Santinello. So good morning, Chair Edwards and committee members of Division 3 Finance. I am very happy to be here this morning, and I am here in my office in Concord by myself. So what I thought we would do today, the Division of Economic and Housing Stability is a relatively large division within the department. And so what I thought I would do is just give you a high-level overview of what DEHS is, and then we're going to go through later this morning and into the afternoon each of the bureaus, and that is where actually all of the finances are within the bureaus. They're not within our division, but I thought it was important, if it's okay with you all, to start with just a division overview.
Are you able to see my hand?
Yes.
Okay, so if there are questions throughout your presentation, I'll just raise my hand. I want you to go ahead and complete your thought. It doesn't need to be a hard interrupt.
Yep.
Okay.
Okay, that sounds good. So can everybody hear me okay?
Yes.
And I would like to give you a heads up that I want to spend additional time, more than you probably planned, around the slides leading up to and including the social determinants of health.
Okay. That sounds good to me. Okay, so I'm just going to get started with the mission of the Division for Economic and Housing Stability. It's to advance the health, economic, and social well-being of individuals, families, and communities. And our vision is that individuals and families,
It sounds like you're reading off of a slide. Can we present her slide, Ms.
Oh,
Ripley?
I'm so sorry. Should I be
Right.
doing?
No, it's fine. If
Nope.
you have a slide deck we should be following, we just want to have the slide deck up so we know what's
Yep.
slide.
You know what Kevin, do you have them or do you want me? I'll do it.
I think you should be able to share your screen if you have them.
Yep, I just have to, I'm sorry, this is just a little new doing it this way. But I will pull them up right now.
Really kind of works out great because everyone knows exactly where you're at.
Yep.
And the public can follow along. It's really good.
It's fine. Okay, so now I'm going to do screen share and then I don't have to keep on saying, why can't I, wait a second. Sorry. Okay. Why is it not showing up? Well, 1 second, technical difficulty here. Let me just do it one more time. All right, here we go. I think Dave's going to try to jump over. I'm all set. I got it. Thank you. It helps to have Dave in the office next to me. I'm just going to go to the next slide. All right. All right. So our mission, which is not actually in statute or rule, this is something that the division heads and I came up with about a year ago. It's to advance the health, economic, and social well-being of individuals, families, and communities. And when we get to that point, we think that our vision will be that individuals and families are strong, resilient, and thriving in their communities. And the next slide shows you the programs and bureaus that we're going to talk about within the Division of Economic and Housing Stability. So that includes the bureaus of family assistance, employment support.
It was the internet, but
Somebody probably should go on mute. I think maybe Representative Wallner, you got some background noise?
New Heights, the Bureau of Child Support Services, the Bureau of Housing Supports. We also have comprehensive family support and family resource centers, the Bureau of Child Development and Head Start collaboration. And while the preschool development grant is not a department program, it is something that we are working on collaboratively with the Department of Education and through the University of New Hampshire. So I just wanted to point that out here.
Okay, now, all of those 8 boxes are divisions or bureaus, is that correct?
The preschool development grant is a program that we work in collaboration. New Heights is our IT infrastructure for this division and other parts of the department. And then comprehensive family supports is a program, so that's not a division. And I'm going to talk about a couple of those programs here in this overview.
And then do all 8 of those boxes receive state funds, or are some of them federal funds only?
So the preschool development grant is 100% federal. And that is, the money is not even with our department, it's with the University of New Hampshire. And I believe everything else, which we will get to in later slides, has a combination of federal and state general funds.
Thank you.
Okay. So the our division, our focus is we serve individuals and families from birth on through the lifespan. Our aim is to really provide a whole person, whole family approach. We emphasize the importance of social determinants of health and the impact it has on an individual and family. One of our goals is to really focus on reducing programmatic and system barriers. We have a tendency to have people fit programs, not have the other way around, and programs fit people. And so that's some of the work we're trying to get to. We're really focused on strengthening programs, organization, and be solution focused, and shared leadership and integration and working together.
So I have a question there.
Okay.
And the third bullet about social determinants
Yep.
of health and its impact,
Uh-huh.
is that a statutory thing, or is that something the commissioner and you came up with?
That is something that we came up here with at the department. Okay.
Yes.
Okay. So that ties in really well into the social determinants of health. And these are really kind of, these are known as the conditions in which people, yep, hold on a second. Okay, thank you. Oh, Dave's
Just
helping
asking
me.
for some coffee now and you're good.
Exactly. I know. I wish I could. Thanks, Dave. Are the conditions in which people are born, grow, live, work, and age. And if you look at these social determinants of health, there are lots of things maybe that we wouldn't necessarily think of when we think of the Department of Health and Human Services, yet we touch all of these social determinants of health in some way within this division. And so I think we really try to look at these when we do some of our work, that if you think about education, children are ready to learn, well, that impacts our Bureau of Child Development and Head Start collaboration. Employment and income stability, that crosses our Bureau of Child Support, Bureau of Family Assistance, Bureau of Employment Supports. Health and well-being, that's access to health care. Housing stability, we hear about that all the time. If a family isn't stable in their housing and they're having to move multiple times, that's going to impact a family. And so and food and nutrition. So all of these pieces touch in some way on within our Division of Economic and Housing Stability.
So I have about 8
Yep.
questions on this slide.
I hope I have eight answers.
Oh, you do.
I hope so.
These are all 101 questions for you.
Okay.
So graphically, this suggests, and it probably doesn't mean to, but it implies that all of these determinants are co-equal, that they have an equal balance and equal importance, and therefore an equal prioritization within the department.
Mhm.
That's probably the wrong graphical takeaway. Are there priorities in here for what your bureau is looking at?
So within here, there's certain pieces that this division does have an impact on directly. So that would be housing stability. And we're going to hear a lot more about that with our Bureau of Housing Supports. I think employment and income stability, and I'm going to talk a little bit in a little later about some of our efforts for upward economic mobility. So I think housing and employment, as well as access to healthcare, food and nutrition, education. It's hard to say, okay, what are the pieces that are most important, because it all makes up a person and a family and a community. But the pieces that we have the most influence on, I would say, are food and nutrition, kind of over to housing stability if you're going counterclockwise, and then early education.
Okay, and then I don't actually see healthcare delivery on here, but I think you suggested that it was under the health and well-being, that the healthcare delivery system is somewhere in health and well-being.
Yep, I think that's their desired level of physical, mental, and emotional health. And this division doesn't have responsibilities for the actual healthcare service system. We facilitate access to that. So you'll hear more from Henry Littman later when he talks about the division of Medicaid services. But we partner very closely with Medicaid because people access Medicaid through the Bureau of Family Assistance.
Okay. And then I see under well-being, emotional health.
Mm-hmm.
So that makes me wonder, is that something we're going to put into a database somewhere so we can do population management on emotional health?
So I'm going to defer that to when Katja Fox talks later, because she has the Bureau of Behavioral Health. Again, these are all aspects of someone's health and well-being, and we focus on access to those programs. Does that help?
Okay. Well, it does. And I'll just tell you, maybe you can tell from my questions, but I'm really concerned about the future of DHHS managing or getting involved in the totality of the social determinants of health. This is a potential area of massive scope creep to what the mission of DHHS was initially thought to be. I very much am a big supporter of DHHS having a direct hands-on relationship to New Hampshire's healthcare provider network. And as a human living in New Hampshire, I'm concerned about these things that are on this slide, but I'm just really concerned about a state entity thinking it's their responsibility to manage this on behalf of the population. And I think that could just be way too interventionist.
Yeah.
And so this is I'm not going to be hostile, but
Yep.
I am going to ask you a lot of questions about how much money are you spending in these areas to do more, the distinction between monitoring status and intervening to ensure the economic stability of families. I think that's a gray area that we really need to look at.
So just to clarify, we don't have responsibility for all of these areas. We need to understand the social determinants of health and where we intersect with those. And so when we're working with an individual and family, it's important for us to understand, do they have food and nutrition, and can we assist with access to that? You know, are there employment opportunities and income stability we can assist with, but we don't take responsibility for all of these pieces. These are all of the things that make individuals, families, and communities healthy and thrive. And so we have certain pieces of those, but not clearly all of them.
All right. Well, thank you. It's the beginning of a good, long conversation. So continue.
Okay, Dave is doing something with my computer. I don't know what.
It's going to be good.
Okay. Huh?
It's
That's
going to
what I
be
heard.
good, whatever it is.
I don't know what it is. It's not coffee though. Okay. Are we okay? Was there too much showing? Okay. Sorry about that. So, okay. Good thing I didn't do this at home. Okay. So now I can't move to the next slide. Okay, so a couple of the programs I wanted to touch on that are not going to be highlighted so much in the other areas is family support. We have community service block grant and whole families approach to jobs. So the first piece is our family support. And this is, we have comprehensive family support, which is a home visiting program that is focused on strengthening parents in an effort to reduce child maltreatment and increase child and family well-being. This program is voluntary. It serves individuals and families from birth on through the lifespan. And really what the focus is trying to assist families when they say, I need a little bit of help with parenting in a preventative way so that they don't need more intrusive services later on through DCYF. We also provide access to family resource centers across the state of New Hampshire. And those are primary prevention services, and many communities have them. And they offer such services as parenting education, workshops, a place for families to go when they're not sure where to turn, and access to services. And then finally, we work very closely with the New Hampshire Children's Trust Fund, and they provide infrastructure support, quality designation, and support to the family resource centers to be able to do their jobs. And a new program over the last, I want to say, couple of years has been in the area of kinship navigation. As some of you may be aware, we have a large number of family members who are either raising grandchildren, other family members, and lots of times they need some additional support. And kinship navigation is a way to give those families access to services and supports. So that the children can remain with the family and not need to be in foster care through the Division for Children, Youth, and Families. We also have the Community Services Block Grant, and those funds go directly to the 5 community action agencies across the state of New Hampshire. And this is federal dollars, but it's really has a focus to reduce poverty. And so the community action agencies are granted the majority of those dollars for direct service, for infrastructure, as well as an opportunity to develop innovative programs across the entire family. And finally, we have the whole family's approach to jobs, parents working, children thriving. And Representative Wallner actually has been very involved in our efforts across the state with this. And this is an effort actually that Governor Sununu is behind, and really assisting families to get out of poverty through work, at the same time supporting business. Because prior to the pandemic, we know that New Hampshire's unemployment was really low. But yet, and there were families who are receiving public benefits, and some of those families weren't able to work because of this real phenomenon called the cliff effect. And what that is, that's when a family, an individual either starts to work, is coming off of public assistance, but yet the benefits, the loss of benefit, the increase in income does not match the loss of benefits. And families actually end up being worse off by working or taking a promotion than not working. And as a state, one of the things is we need as many workers as we can as we move into the future. And also we know that a family that has its own economic resources, is working in the long run, is going to be better for the individual, the family, and the community as a whole. And so we've been partnering with New Hampshire Employment Security to conduct an economic analysis to say, okay, are there certain policy changes we need to make in how we administer benefits that enable people to work? So that's some of the work that we're focusing on. Yep.
So New Hampshire has bureaus of economic assistance and BIA, and there are other entities within state government that
Yep.
worry about the health of the economy.
Yep.
And so when I look at a DHHS slide that says your mission includes creating economic mobility pathways, that reads to me like something that is not in the DHHS mission.
So what is in our mission is access to, let's say, for example, childcare scholarship, which we're going to talk about after this presentation. So the childcare scholarship or temporary assistance to needy families, as a department, we set the policy for those programs. And if the child care scholarship, the loss of that benefit makes it so people don't want to work, and then that impacts other state departments, that's what we need to understand. So we can say, maybe we need to change the access to childcare scholarship so that it encourages more people to work and have people come off of unemployment. So it's not our responsibility to do the employment pieces and the business development, but what are the policies that inhibit some of people coming to work? That is within our control.
That sounds reasonable.
Okay.
Representative Wallner, I have a question for you since your name was mentioned. I've been concerned about this cliff effect where people who are on public assistance who go into the private employment, they lose so much in benefits, it's not worth the money that they make in the job market. And so I'm curious what you know about previous efforts to create sort of an incremental stepwise approach so that there's a staircase there instead of a cliff.
Well, the program that I could speak the most about is childcare. And in childcare, there are steps. So a parent comes in, they are eligible for the program, for the scholarship. They come in, fee, the parent fee is set according to their income. So let's say this is someone just coming off public assistance, their income's very low. They would have a low fee, but as they get a raise at work, then they pay more of their part. And the scholarship is less and the parent pays more. And there are several steps to work towards gradually having the person take full responsibility for paying for childcare and no longer needing the scholarship. So I think that's sort of an example. there's work to be done in that area, but that is an example of how they have sort of started to work on the cliff effect.
And that is one of,
Chris, would you
Yep.
agree with that?
yes, and actually, I just was sending out the draft, the final report to the committee members, and one of the things they're recommending is that, yes, as Representative Wallner mentioned, there are steps throughout childcare scholarship, but then when you get to the end, it's a really big drop. And I'm sure Representative Wallner can attest to that. It is a big drop. And that's where families are really struggling with, do I stay working? Do I take the promotion? And so that's one of the areas where we really need to invest some of our time and energy to say, do we have more steps that are more gradual than we offer now?
So if you need help with that, I'd be happy to help you with that, because it's a great concept. I don't want to create perverse incentives for people to stay on public assistance. I think the emotional well-being of an individual increases when they have a job and they feel productive. So
that is great. And actually, if you're interested, I can actually send you the economic analysis once we have that for you to review. With the partnership with New Hampshire Employment Security, we looked at the state, 40 different communities and towns. So we really tried to get a diverse representation in different parts of the state. So we're really hoping it's going to help us move some of this forward.
thank you. So before you get going again, there's been a lot of discussion here. Are there any questions from the committee members in here? I'm not seeing any.
Okay.
You can get going before I interrupt you again.
Okay, that's fine. Whoops. Okay. Okay. So I just wanted to talk, and I believe that Dave Wieters, who is on the line right now, did mention a little bit about the New Heights system. And the New Heights system is programmatically housed within the Division of Economic and Housing Stability. And so we have an integrated eligibility system which assists with access to services for Medicaid, childcare, SNAP, TANF, access to long-term care. So it's a very robust system that drives eligibility for services within the department. Through New Heights, we also have New Hampshire Easy, which gives individuals the access to apply for benefits online and also upload documents and do some different things via an online portal. Any questions on this right now?
No, I'm kind of up on New Heights.
Okay, all right, great. Good to know. And so one of the complications of New Heights, because it's integrated, which for the consumer is excellent. There's lots of other states that do not have integrated eligibility systems, but what that means is that we have to work with lots of different federal authorities when we are working on any New Heights changes. And so it's not just Medicaid, it's also Food and Nutrition Services and the Administration for Children and Families. So anytime we think about having to make changes with Heights, we can't just work with one of our federal partners. It's working with all three of them, which sometimes can make life a little more complicated.
Sure. I have a couple questions here.
Okay.
And it may be that Mr. Waters needs to answer part of it, but so this slide implies that all of these compliance requirements have been fully implemented and are now fully supported. Is that what this slide is supposed to say, or are there some of these that are still TBD?
So we are in compliance with all of these areas. I do have Lori Snow, who's the administrator, and Dave Wieters on this Zoom if you would like more specific questions.
Well, that's a good one.
Okay.
And my next question, and you don't know the answer, I'm sure, is that we talked to Meredith Tellis yesterday. Or the day before. It's all blurring together, but she had some eligibility system requirements that she said would simplify a tremendous amount of her manpower. And I'm just curious if, where she is on the list of implementations.
So my understanding is what Meredith will do is she will look at pieces of the New Heights data. One of the things that she's looking at is video interviewing so that they don't have to go out into people's homes. And that's something that would be built through Heights. But the other piece is when Meredith's group looks at some of their data integration, some of that comes from MMIS. If they're looking at claims and things like that.
I'm a little foggy. I'd have to look at my notes. I thought she had a set of requirements for eligibility management that were not yet implemented. So
I can get back to you and find out exactly what those may be. Is that okay?
Oh, sure.
Okay.
And that's over the next few weeks. Don't hurry on that one.
Okay. Yep, I will do that. So eligibility requirements. All right. I will follow up on that. Definitely. Anything else?
Nope.
Okay.
Thank you.
Great. So this is just a overview of the different bureaus within our division. You'll see Bureau of Family Assistance and Employment staff. We have about 455 staff. And it's about $120 million. Bureau of Child Support is here, the gray circle, that's 127 staff. Our Bureau of Housing Supports has 5, and Child Development and Head Start Collaboration have 10. The Bureau of Housing Supports, which we're going to hear about in 2 bureaus from now, contracts out all services, so that's why they have the limited number of staff.
So I'm just doing the math of the staff in my head here. And I'm thinking that New Hampshire has 1.3 million plus or minus. And is there an external benchmark for how many people ought to be working these programs given the population size?
So by each program, there are certain benchmarks for the Bureau of Child Support and the same for Family Assistance and Employment Supports. And we'll get into a little bit of that when we get into those bureaus, because for the Bureau of Family Assistance, we have deadlines for timeliness and, application error, efficiencies. And the same with Bureau of Child Support. We have very specific time limitations. And so there are some benchmarks, which I can get those for you. I don't have those with me today.
Okay. Well, great. Thank you.
Okay. All right. I'm just writing myself notes.
There's a question there by Representative Wallner.
Okay.
Yes, thank you. Just while we're at this slide and looking at the staffing, could you tell us how much a vacancy rate you have at this point?
Off the top of my head, I do not know that. Rebecca, do you know off the top of your head?
No, I don't have that information on me at this time.
I can get that for you. We have the one thing, I know in the Bureau of Housing Support, we have 1 vacant position. I know in Child Development, Head Start Collaboration, we have 2. And in the Bureau of Child Support, Family Assistance and Employment Supports, when we did have the hiring freeze, the those workers were considered direct care workers. So for eligibility and child support officers, so they were not part of the hiring freeze. But I can get the actual vacancies for you by bureau.
I was particularly wondering about the Bureau of Family Assistance. It's got 455 staff. I wondered what the number was there.
Yep,
And what
yep.
the vacancy.
I can get that for you probably by the time we hit that presentation.
Okay, great. Thank you very much.
Yep, Deb Sorley, if you're listening.
Representative Nordgren has a question.
Okay, I can't see that. Okay.
Hi, good morning. Thank you.
Good morning. Yeah.
Could you mention the hiring freeze? Could you please talk a little bit about that, the time frame, how it affected your department, where it is now?
Sure. So when we had the hiring freeze, and I don't remember actually when it started, to be quite honest with you. We actually, in our Bureau of Child Support, Family Assistance, and Employment Supports, the frontline workers, so for family assistance, that is the family service specialist, the person that an individual will meet with to get access to benefits. In the Bureau of Employment Supports, that's an employment counselor. And in child support, it's the child support officer. Those positions were not part of the hiring freeze. So we were free to go ahead and hire those positions because they were considered direct care, which was extremely helpful. Unfortunately, some of these jobs are entry-level jobs, so you do have a higher turnover. But in the area of, in family assistance, we have a policy unit that works on policy to support some of our programs. Those weren't considered direct care, so those positions were frozen. And so for a while, and also our training unit, we were moving staff around, trying to make sure we were, meeting all of our expectations. So all of those have been lifted, and we are actively recruiting on those positions.
Thank you very much.
You're welcome. Are there any other questions?
I have a question. Under the Bureau of Family Assistance, Bureau of Employment, what do you feel is about the right number of job descriptions you have throughout that 455? Is that you probably have 10 different job descriptions in there, or what?
Probably FSS 1, 2, 3. Probably within BFA, I would say there is probably around 10 or so. And then employment supports, there's probably about 5 or so. One of the things the staff have been working on, the bureau chiefs, is when you have certain administrator positions, they're a little more generic to the role of administering a program and not so program specific, so that we can ebb and flow. So I can get you the exact number, but I would say probably about 10 to 15.
Now what I'd really like here is an actual job description for a person whose job it is to engage families, engage clients, a client-facing job description.
Okay, great. I will get that to you after today. Is that helpful?
That's very helpful.
Great, thanks. Okay. Any other questions on this slide?
I don't see any.
Okay. So some of our key accomplishments is that we've brought together multiple program areas to form a division with a focus on family strengthening and upward economic mobility. I think one of this, because this division was formed in 2018, and so I think one of our biggest strengths has been we've been really agile and nimble to meet the needs during the pandemic. We have led many collaborative efforts across New Hampshire, the department, and New England, with a real focus on being responsive to the needs presented. And all of the different bureaus will talk about that a little bit when we do specific bureau presentations. We've actually been, yep,
So
go ahead.
question here. So as I read that, my eye catches family strengthening.
Mhm.
And so that, and since it's an accomplishment, it suggests it's measurable. And if it's measurable, that means somebody has developed a baseline definition for what constitutes a strong family. Because if you don't have criteria for what you think a strong family is, it would be very hard to measure whether or not you're making progress.
Mhm.
So I'm curious,
Yeah.
somebody has developed a definition on what we consider the state view of a strong family to be.
So I think there's a couple of different measures. One of the measures we use is with our comprehensive family support program, which I mentioned earlier, and that is a preventative program. And so one of the things we look at is if a family, we do this class of data, okay? And so when we have families who leave the program every year, we follow them for about 3 years and we see, did they end up in DCYF, needing DCYF services for a period of time? And we track them for about 3 years. And so when I look at the last 3 years, so for people who left this program in 2018, 89% of them continue to avoid DCYF services. And so
So that's the major measurement, is
that's
whether or not they're using DCYF services.
that's one of the measurements. Another measurement we look at is how many people were we able through New Hampshire employment program to actually get jobs, because that's going to help a family to care for its own family. During the pandemic, one of the measures the Bureau of Employment Supports looked at was the number of people that they assisted to obtain high school diplomas. And so that's a benchmark we look at. So we try to look across all of our programs to see how many families are we giving access to, are we assisting with child support, because that's helping to keep a family strong. Access to quality early childhood. So we look at a couple of different measures across all of our programs.
So I'm just trying to understand the lines of delineation of responsibility. So moving people into employment, I think, would be an accomplishment of the Division of Employment Services. And I would think the number of people graduating would be an accomplishment of the Department of Education. And so when I see a slide that says DEHS key accomplishments, I'm just
Yep.
curious how the actions and successes or failures of these other departments, how they're viewed as moving your mission forward.
Yep. So I think and that's why it's really important that we collaborate with these other departments and divisions, because while yes, somebody completing high school is the response, falls under Department of Education. What we do is we assist with some of the barriers that may be in the way of somebody completing their education. So through our TANF program, we have barrier reduction services through our employment security, our Bureau of Employment Support. So that will help with some of the cost, accessing childcare, an employment counselor to help them get through and maneuver. So we partner with those programs and provide the supports that somebody needs to be successful.
Okay.
Okay. We have been actively involved with the Council on Thriving Children and the Council for Housing Stability, and we're really hoping that some of this work will help the state and the department look at at ways for people to maintain their housing. And again, we are moving forward with the economic analysis of the cliff effect, and that has been an accomplishment because we were working on it when the pandemic hit. And then we, continued to have it evolve and grow through the and look from data that we collected during the pandemic to help inform us.
Thank you.
Yeah. Some of our challenges are that there are siloed funding streams. And I think that's something that we're trying to really figure out, is because that creates silos of program delivery, right? If you're working in a program and you see that you only, the funding, is for X, but yet the family really needs Y, how do we help support that? And so that's really a challenge.
And then the other piece that goes with that is you typically end up with departmental information system silos as well.
Yep.
And you don't have
Right.
I don't want to put words in your mouth, but I think that's coupled with that, right?
Yeah, interoperability of our data systems. And so that's something that is a challenge. And then, workforce limitations, right? We have, there's, a limited workforce. And so that also becomes difficult if we have, turnover. And then also with our community partners, if they're having difficulty with hiring, that also becomes a challenge for us. And then the, whoops. My slide
So
thing.
the lack of interoperable data systems is probably an artifact of the fact that the programs started siloed to begin with.
Right. Yeah. And I think some of that is some of the federal regulations and really understanding what they are and working with our federal partners for us to figure out the best ways from a family perspective, because I think there's nothing worse than providing your information and telling your story multiple times. And so how do we help families get around that to make sure that, every door is the right door. And while I may not have all of the programs they need, how do I get them to those programs in the swiftest amount of time? So I think one of the questions we were asked is a 5% increase or decrease. And so if we had an increase, we would really enable New Heights, which is our IT system, to enhance support for critical services. We're really working on how do we have people get what they need through technology. And so there's lots of things that we can enhance through our New Heights and New Hampshire Easy system, as well as support the field with technology enhancements. So that would be critical for our division. And then really continuing the work with New Hampshire Children's Trust. They're our facilitating organization to really assist with family resource centers, which are across the state of New Hampshire, provide families with access to services when they need them. And whether it's a parenting class, whether it's a play group, whether it's going to somebody saying, I'm having these struggles, how can you help me get some services for myself or a family member so that families can remain strong in their communities? If we have a decrease, then really New Heights will not be able to meet some of our technology needs. And then also some of our work to strengthen families will have to be decreased. And then it doesn't mean the needs go away, right? It means that the needs will then show up through DCYF. And so are there ways we can continue to provide preventative supports when families need them at the right place, at the right location, so they can get access to the services they need?
So thank you very much for this slide. I realize it's a new slide.
Yep.
So what would make this even more useful to the committee, I think, is if you could take these and make them more specific in the sense that they might become measurable.
Okay,
You
sure.
know, it's hard to say, you know, what the impact of the top
Okay,
incremental, yeah.
sure. And I can get that to you after.
Well, that's kind of in a 2-week time frame kind of thing.
Sure.
You
Yep,
know,
that's fine.
think about it and give us something hard to where we say, okay, what are we going to get for our money?
Okay, that sounds great. Thank you very much. And then the final piece is, and we're going to talk about these in each bureau, but I just wanted to give you a high level of our division's prioritized needs. And again, these will be talked about in each of the bureaus because that's where the funding is, but these were our prioritized needs. And so you'll see they vary. With childcare, it's our protect and prevent, our quality system. And then housing has a couple of very specific prioritized needs. And then we have child support and our family support. But again, we'll talk about these in each of the bureau slides.
Right. And so just relating this to the previous slide, it looks like some of these might be in the increment side of
Yes.
what would be measurable.
Mm-hmm.
Now, the $0, that means you asked for it and the governor's budget process zeroed it out.
Yeah, these were our prioritized needs. So yes, we did not receive any of these dollars.
Did you get some of your prioritized needs from the governor or none of them?
Rebecca, I don't think we got any of them, did we?
We did not get any.
Representative Nordgren has a question.
Sure. I can't hear her.
She's on mute.
Oh, okay.
Representative Nordgren, you're on mute. Could you want to?
I'm sorry. So in the columns up at the top, House Bill 1 with the fiscal year 22, House Bill 1 with the fiscal year 22. So way on the right side, should that be saying a fiscal year 23?
Rebecca, yes.
Thank you. Yes.
Okay, thanks.
Yeah.
Good eye.
We all, you know how many times we reviewed this and I found a type, I neglected something on the next slide deck. I'm like, oh, but I already did the PDF. So I was like, oh, you look at things so many times. So.
So, okay, this is
Okay.
this is useful. Did what is this child support out of state mileage? How much do we need to go out of state? What is this, like 1 trip a year? Or is that 10 trips a year?
No, it's really 1 or 2 trips a year. And in this past year, obviously with COVID, we haven't used that. And so that would just be something for next year. And the in-state mileage is really going to court and helping, do their work.
So if they're out of state, how are they still our responsibility?
No. It would be like if somebody had to go to a conference.
Oh, child
Yeah.
support out of
Yeah.
state mileage is not to
Yes.
support a child, it's to
No.
support the training to
Yeah.
support the child.
Yes. Sorry about that.
No problem.
And then the next slide is just some of the areas in family support and BFA. And we'll talk about all of those when we get to the actual.
What is an empath membership? What
It
is
is-
an empath?
Yep, it is a professional association that assists our employment support counselors with assisting people who are on our TANF, temporary assistance to needy families, come off of TANF through employment.
One membership, or is that like a group license?
It's a whole group membership for like, a whole year, and it supports all the staff with, some conferences, some technical assistance. So. Was there a question?
No, I'm saying
Okay.
you can continue.
Okay. and then this is just our staffing. And so I just wanted people, this is just a summary of the staffing in our budgets. So this is it for the overview slide. So we were then going to move to the Bureau of Child Development and Head Start collaboration, if that's okay with everybody.
Let's just do a sanity check on that. Is this Mr. Ripple? Is this a good time? Are there associated budgets that we should dive into from here, or do we need to see the other slide deck before any of the
This, I think, was the bigger picture presentation. I don't think there's a budget associated with that one. I think we would move on. Is that right, Karen? Okay, yeah.
All right.
Move on to the next one.
So as a time check, I would like to take a recess in about 40 minutes, 40. So has anyone come up with a reason we shouldn't recess then? Let me know. All right, go ahead. You're good, Chris. You ready?
Okay, so we can continue, right?
Yes, ma'am.
Okay, so can you see my slide?
Yes.
Okay. All right, I'm just gonna pull another piece of paper. Yeah,
Chris, can you share just the presentation and not the entire screen?
sure. I don't
Thank
know.
you.
I'm not,
What
Huh?
happens if you hit presentation mode on your PowerPoint?
well, why is it nothing's happening actually? Can you, all right, Dave? It's
I
a
think
PDF,
it's
that's
good, Ms.
why.
Rounds. It doesn't bother me.
1 second. Move it here. But then I need to move them over here. Okay. 1 second. Okay. Where did it go? Okay. Is that,
Not sharing.
okay, yep, I'm working on it. Right here. Okay, is that, can you see it all now?
Yes, thank you, Chris.
All right, sorry. Oh my goodness. Okay, we'll get there. Okay, so this is our Bureau of Child Development and Head Start collaboration. And if my cursor is not on the right screen. The mission statement of the Bureau of Child Development and Head Start collaboration is to partner with child care licensing, the Head Start community, Department of Education, and others to ensure that all children enrolled in early childhood out-of-school programs experience continuity in a high-quality setting. This statute is not in statute. It is our own mission statement, but we do include it in our state plan that we that we have to comply with. So the overview is that we administer the state general funds for childcare. We provide funds to eligible families for children up to the age of 13 years. We work to recruit, enroll, train, and support childcare providers. We work very closely with the childcare licensing unit, which I believe Melissa St. Cyr may have talked about on Thursday. We also administer our child care development funds quality initiatives. We try to ensure that we partner with other quality initiatives across the state. We offer consumer education and resources. We provide access and referrals for families. And we also work with school readiness to ensure that children in childcare, when they leave childcare, are actually ready to move forward with education. So our next slide, these are the number of children who receive child care scholarship. And you'll see that these numbers have been decreasing over the last couple of years. And we are really trying to spend some time trying to determine why is the numbers decreasing. Some of those numbers have to do with the fact that people we have very low unemployment. And so people are working and they may be making a little bit more money than our scholarship allows for. Or one of the other things that we talked about a little bit earlier is the cliff effect, because this is for people that are working. And if the scholarship doesn't assist enough with the cost of childcare, then families aren't going to work. And and even if a family receives New Hampshire Child Care Scholarship, they are still going to have some out-of-pocket expenses. And so that's something that we're really hoping to look at as we go through all of our cliff analysis. Childcare is probably one of the biggest areas of areas to focus on. Also, in the past, we used to include the children who receive protect and prevent dollars in these numbers. We used to use child care scholarship, those federal dollars, to support those children. And those are children who are involved with the DCYF or at risk of being involved with DCYF and need preventative child care. But we move those children out of child care scholarship because once a family is in, this might be getting into way too much detail, so I apologize, but I think it's important to set the context, is if a family is eligible for child care scholarship, they're eligible for an entire year. If their income changes, their circumstances change, we can't take a family out. And so that would be the same for the protect and prevent child care. So it was better fiscally for us to have those children funded differently and not have to meet the 12-month eligibility requirement.
So a question about this, is
Yeah.
this, these scholarships, is this a mix of federal and state money? And if so, what portion is the state money?
Rebecca, can you answer that question?
Sure, it is a mix. There's, we have to match part of the grant dollars to utilize all the grant dollars. I just need to look to see how much. I believe it's about 10 million that is state general funds and about maybe, is it 26 federal?
So we have about a 75% match somewhere in there, or a 25% match, something like that?
Let me just get that open.
We can continue.
Okay.
As we go through these where there are clear programs,
Yeah.
and there's a match requirement, it would be great to highlight exactly what our match requirement is and where we are relative to accessing the federal funds that we may be eligible for.
Okay. And Rebecca, we do draw down the federal funds first, correct?
No, actually, we
the
utilize
other way
the general funds first. Okay, so the federal funds total 16 million, and we have to match 10 million.
Okay, so we have to come, I can't do math in my head. Is that about a 40% match requirement? Is that in their rules? 40%, something?
Actually, it's specific to, there's three parts of the child care development fund. There's a mandatory that we have to match, and then there's a matching piece that we have to match, and then there's a discretionary piece that we do not have to match.
So let's ask you this. Could you offline create an explanatory document on some of these, on the big programs to help us understand what the match rules are and the extent to which we're taking advantage of them?
Sure.
Sure.
And I think too, when we go through the budget, the actual line items, that might help too, but we can actually, yeah, we can definitely do the document. Great, okay. Oh, was there a
Did you have a
question on that? Sorry, I'm
Oh,
sorry.
there's a question by actually two people. So
Uh-oh,
let's go with
okay.
Representative Wallner and then Representative Verf.
So I heard, Chris, I heard you say that one reason that we might be seeing the childcare numbers going down a bit, obviously they've gone down during the pandemic, but before that, when did we back out the protective preventive children out of these numbers?
Rebecca, was that in 19? I believe it was state fiscal year 19.
And could you tell me how many children do you think that was? Just a ballpark of what the number was.
I don't have that right here, but let me see. I can get that for you, Representative Wallner. Because I don't, we actually, I have it here, but it's based on dollars, not children. So I can get that for you.
Great.
So to be literal there, when you say get that for Representative Wallner, I think what that means for our committee is that somehow you all get it to Mr. Ripple and Mr.
Yep.
Ripple that he shares it within the committee.
Yes.
You have another follow-up, Representative Wallner?
Yes, just really briefly. Thank you, Chris. I appreciate that. And it's the first time actually I had really realized that the protective preventive were no longer in that employment figure. So it would be interesting to know. The other question I wondered was, I see on your chart, you're talking about a monthly average.
Mm-hmm.
Do you keep statistics, I'm sure you must, on the total number of children in a year who benefit from childcare scholarship? Because some children may only, for instance, need it in the summertime for a couple of months.
Yes.
So the number, it would be interesting to know how many total children get a childcare scholarship in the year.
That is something I believe we can get, right, Rebecca?
Sure.
Okay, yes, we can get that to the committee. How is that?
Great. Thank you very much.
Yep.
Representative Verf?
Thank you, Mr. Chairman. I'm just having a difficult time understanding this scholarship children versus protect and prevent.
Go back one slide, Ms.
Yeah,
Santinelli.
I'm trying
Is there
to.
some overlap there, or are these distinct groups?
So I'm trying to. There's two different ways that we fund child care assistance.
But 1 second though. Now you're talking about funding, which kind of makes sense to me, but these are talking about individual children.
Correct, but we used to include, because the children who receive protect and prevent dollars, it used to be paid for with our child care scholarship. So those children were included in the monthly average and the yearly numbers. But in 2019, we moved and stopped using child care scholarship funds for those children.
Okay.
So those children were included in those numbers, and then we stopped doing that because of the funding, the funding stream.
Okay, but the children were still getting dollars to help in this.
Yes, absolutely. Yes, those children and families. And so I'm going to get for the committee how many children a year we serve in protect and prevent.
Thank you.
You're welcome. It does. I apologize. It does get a little bit confusing.
I have a question about the literal definition of the word scholarship in this context.
Okay.
Is this for kids up to 13 years old, right?
Mm-hmm.
And this is money that's going to daycare providers, to private schools, to who, for what? I
It's
mean,
for,
the term, a scholarship to me is specific money to help pay for academic development. And I'm just curious if that's what it means here.
it means it goes to childcare providers that are either licensed or licensed exempt to provide childcare. And it goes to the providers to cover the cost, a portion of the cost of the childcare services. So other states call it the Child Care Development Fund. New Hampshire, before my time, chose to call it the scholarship program.
Sure. No, I get it. It's a better sounding word. So my thought here is sort of an age range.
Yeah.
Like what percent? I would imagine a much bigger percentage of this money goes to kids 6 and under than 7 and up.
Yes, you are correct.
Maybe 85, 90% is 6 and under.
I can get you the actual breakout because we do have it broken out. I don't have that handy. But yes, I can get that for you. And the children that are in school, it would be after school care, school vacations, and summertime.
Okay, thank you.
Okay, you're welcome. Okay, and Kevin, you write down all these questions, right? Okay, I'm trying to do it, and I'm like, I'm gonna miss something, so that's super helpful. And so the programs that we offer through this bureau is the Child Care Scholarship Program, which we talked about a little bit. The quality dollars, because we have to use 12% of our grant award has to be used for quality initiatives. And so that can be different ways, professional development, QRIS. So there's a lot of different things that we can do to assist with quality. We really try to provide resources to the actual childcare providers. We work with Head Start and Early Head Start to really collaborate between those programs. Head Start, Early Head Start does provide childcare, but they also provide whole family support and other services for eligible families. And then New Hampshire Connections is actually our new childcare system, database system that really assists with families, with childcare providers, applying online, paying for things online, billing online. So we're really trying to enhance our electronic capabilities with the childcare community. As an example, when during the pandemic, there was a significant focus on supporting childcare centers and childcare providers to operate. And the department, we through the governor's office, through federal funds, we got a lot of money out the door to childcare providers, but we had to do it in SurveyMonkey, Excel documents, because our data system wasn't able to meet the demand that we needed. And so we had to do a lot of emails, phone calling, a lot of manual processes. One of the benefits is we were able to make some enhancements to our New Hampshire Connections project related to COVID. And now we have a new $20 million federal award, and all of the awards will be generated through our IT system, New Hampshire Connections. And so that's going to be a huge benefit to the childcare providers, as well as our staff and finance staff processing payments.
So we take credit card payments through New Hampshire Connections?
Well, we wouldn't take a payment. It would be for a provider to bill and then for us to pay them. Yep. Like we mentioned, services are provided to children birth to age 13. We work with childcare licensing very closely. And Head Start and Early Head Start provides 48 sites throughout the state, and that is done through the community action agencies. Some of our accomplishments, and this is the one slide I realized yesterday, I'm like, I didn't put our accomplishments, is, during the pandemic, we kept childcare open, which was significant. I think, I think businesses really realized how critical childcare is to the economy when all of a sudden schools were remote. We currently have 768 licensed program, which allows for about 45,000 spots. We stood up 4 emergency childcare programs. We distributed $38 million of funds from Gopher and an additional $7 million of direct money from the CARES Act. And then we also implemented 14 emergency policies to support families, providers, and children. So for example, we allowed providers that bill for our CCDF scholarship to go into disaster billing, which enabled them to bill regardless if the child was there. So it was based on enrollment, not attendance, because we knew that childcare providers needed that income so that they could open again once the economy started to reopen. We also, and we're still doing this right now, we have COVID absenteeism. So when a child care center maybe has to close a classroom due to a COVID exposure, we're paying for the cost of that service so that families don't have to pay. So that's been a huge support to the child care field. Throughout this time, we've developed a new data system. And what we really were able to do is we offset the cost of this by working with the state of Massachusetts, because they have a system that had a lot of the pieces that we wanted to use. And so we were able to lift and shift some of their codes, which saved us a significant amount of time and money. And I think throughout this pandemic, we've been working very closely with our other New England states to really learn and partner in different ways. And then we've continued to provide professional development in partnership with the Department of Education, using some of the preschool development grant dollars. And we've added new credentials to about just over 300 early childhood providers. So we're continuing to provide professional development, which is critical for quality. Some of our key challenges, I think we all knew, or many of us knew in the field, that childcare is relatively fragile. It's expensive. And so, and oftentimes families may not have the right care at the right location at the right price. And so I think the pandemic really showed us how fragile that system really is. And so one of our challenges is, as well as the silver lining of COVID, is, okay, how do we go back once we're post-pandemic, but not going back to the way it was, because the way it was not meeting the needs of business and families. And so how do we increase partnerships at a community level so that we can really meet the needs of those communities? And how do we partner with business differently? I think business found how critical childcare is to their operations. So are there ways we can partner with businesses and have childcare centers partner with businesses, so maybe they assist with some of the costs for the families that that are their employees, or they support some of the needs of childcare. So it also had showed that, you know, there needs to be more care in infant, toddler, and family childcare. I think what families found is smaller settings really are meeting the family needs better. And so how do we support that and expand that as we come out of the pandemic? Also, workforce challenges. There was and you're going to probably hear this across the board with the department, some of the direct care workforce challenges, which is included in childcare. They have traditionally low wages. Oftentimes it's older workers. And so how do we address workforce challenges for the industry? And then a challenge is also continuous quality improvement. It's really hard, I think, sometimes for childcare providers when they have really long hours, really long days, and limited staffing. How do they then make the time for staff development and continued staff improvement? So those are some challenges within the child development world. So some of our quality standards was that, you know, we have to provide a certain amount of all of our quality standards, and we have to, based on the dollars we spend, we actually have to target some quality dollars for infant, toddler, and general quality. And so
Can we skip this slide, and I'll tell you why.
Okay.
This is the first slide like this in the decks that we've seen so far.
Yeah.
And this is potentially one of my favorite slides of all.
Okay.
To associate the workload and the quality standards this way.
Mm-hmm.
And as I've looked at this slide, trying to just figure it out intuitively, it makes my head hurt. So
Okay.
I'd like to talk to you offline about this if we could, just
Sure.
so I could really understand. There's a whole lot of potential meat here. So
Okay. And that's great. Yep, we can do that. Absolutely. And I think it was kind of, you know, different programs have it differently. So I'm sorry if it made your head hurt, but we can talk
oh,
about
that's
that.
all right.
Okay, great. Thank you.
Limitation of my head.
So this is just an overview of the budget with the mix from 2018 to our current request with federal funds and general funds. These accounting units do not have any other funds. It's either federal or general. And you'll see that the federal funds are the majority of the funds in this program. And we'll go through it line by line in a couple of slides. Okay, anything on this one? Okay. If we had increases, we would increase support for continuous quality improvement. We would actually potentially look to expand access to programs that could be more steps for childcare scholarship. It could be a higher income threshold, which would give families more access. And really, we would look at how do we address some workforce shortages. We are working with other programs within our department. So the Bureau of Child Development is working closely with our Bureau of Employment Supports to say, how do we assist some people who may be on TANF who have a work requirement? Can we do some training to get them into working with childcare? And the same with New Hampshire Employment Security. How do we tap into some of their workers who may need a different job? So how can we do some of that to address workforce shortages? And then really conversely, if we had a decrease, some of those same areas are areas that we would not be able to support.
So my comment is similar to the other slide. Yep. Like this. I think this is a really great start. but if you could spend some time thinking about how this could be measurable so that
Yeah.
you're telling us exactly what we're buying or foregoing.
Sure. Not a problem.
These are all directionally useful, but more specifics on the what would help.
Yeah, okay. Not a problem. And then these are just the different accounting units that we will be going over, I think, right now.
So this is where I'd like to recess. But I hate to do it because we're probably, what, 20 minutes from being done?
Rebecca?
I could be a little longer. Is it just these 4 accounting units or does this go onto a second page?
No, it's just these 4.
Okay.
It kind of depends on the questions that they have.
So I need to step away, and because we're so close to the finish, hey, Representative Irf, are you ready to step in, and I'll step away?
Sure.
Talk later this afternoon about what I'm missing on the accounting. I'd appreciate it. The big thing I noticed when I look at the spreadsheet is it seemed like there were several accounts where there were no general funds appropriated or in the governor's budget at all.
Makes it
And I
easy.
just want to know if that was a mistake or intentional or and what the issues are there. But all right, thank you. So I'm going to step away, and Representative Irf is now the chair.
Great, and I'm going to turn this over to Rebecca Lorden and Karen Rounds.
Rebecca, just tell me what the first page I should go to.
949.
Great. So the first one there is 2976, which is child
Towards the
development.
bottom there.
Yes, towards the bottom here, child development operations. And that goes on to page 950. So any questions on that? And to the chair's earlier question, it's not a mistake that there are not general funds here. This should be 100% federal.
Correct.
Okay. If there's no questions there, I'll move on to 2977, which starts at the bottom of the page, Child Development Program, which is of course the bulk of this area.
So here I do have a question. I'm wondering if the decrease in general funds, which appears to be made up in federal funds, is that the result? Are these funds COVID related here by chance, or is this match related? What explains that nice benefit to us?
Sure, Rebecca.
I'm sorry, what line are you looking at?
The reduction in general funds from fiscal year 21 budgeted to 22 and 23.
In the county unit 2977.
Correct.
In the biennium that we're currently in, there was several initiatives that we had to modify our system for, as well as to align with the federal regulations. And there was additional general funds given to this division to implement those.
It looks like additionally there was about $1 million of general funds that we had to add to this budget. I happen to remember that 564 was budgeted at $2 million for 2020, and that's the protect and prevent. That's children in DCYF care that need to be paid with general funds. And there's a lot of work that's being done in the DCYF system, so we're continuing to budget that at $2 million. So that one would be $1 million in general funds that increased in fiscal year 20 there.
Okay, but what I'm really looking at is between the current year, you have 20 million,
Yeah.
21 million in federal, and the next year you have this goes down to 16 million. But on the other hand, the general funds, which were 15 million which are 15 million this year, also go down to 11 million. Are those, why is that going down? That's my question.
This biennium we received for it's SB, I believe 570. We had received funds to modify the system so that we could get that that population included in the child care. There was some other, I think it had to do with the absenteeism. We had to change the way that we were calculating that to provide more absent days. There was the rate, we always have a rate increase. I know there was a couple of other initiatives that we had worked on for that kind of surrounded the system. So there was more dollars given to us. I believe there was like 5 things.
So were those numbers originally budgeted, or were those numbers because you got more funds like COVID funds or something?
No, the general funds were budgeted. They were given to us in the House phase.
Okay.
Last biennium.
Yeah.
It took us a little longer to implement some of the things due to COVID, and we had other dollars to utilize. So I believe we used the federal funds from some of that, and that would not be reflective here.
Okay.
Any COVID dollars.
Thank you. Representative Wallner.
Thank you. Rebecca, I am concerned about the drop in allocation here in 22 and 23 from back to our actual expenditures in 2020. I mean, we're showing a total funds reduction of about $5 million. That would be $5 million in services. And last week, there was a bill over in the Senate, and I believe you did a fiscal note for that bill. And actually, you were showing that it was closer to 33 million per year that was needed for childcare than it was to 28 million. And I was wondering if maybe at some point you prepare for this division, like a sort of a fiscal note about these particular lines. And I was looking at the one that you did for Senate Bill 144, and maybe you could prepare something like that for this division, so you could see how you get to the 33 million as opposed to 28 million. What I'm worried about here is that if we bring this line down and we end up having, particularly when the pandemic hopefully lessens and people are going back to work, kids are back in school, and people really need, childcare needs are going to increase, that we'll be needing more childcare. And this, what's in the budget at this point, looks like we'll be having less available. And we risk a waiting list at some point. And I don't think that's really a goal here, is to have a waiting list in childcare. So I wondered if you could prepare something that would help us do sort of a formula through those lines.
Sure. Did you want me to speak at all to anything, or just bring you something back?
Well, I think it would probably be helpful, because I am sitting here looking at the fiscal note from Senate Bill 144, and everyone else doesn't have that in front of them. So I think it would be good if at some point in the next, we're not finalizing anything today. So if we take some time with this page at some point in the near future, and you kind of walk through something like what you did here for 144. Does that make sense?
Yeah.
Okay. And Mr. Erf, does that make Representative Erf, does that make sense to you?
Call me Keith. Yes, that's fine.
Okay. Okay. Thank you.
Any other questions?
On 2977.
I guess not.
Okay. And we'll go down to 2978, which is childcare development quality assurance.
Which is basically all federal funds, correct?
Yeah.
Yes. Thank you, Rebecca.
Any other questions there? Or any questions there? Doesn't appear to be so.
All right, then moving on to 2979, which is Head Start state collaboration, which is also 100% federal funds.
Any questions there? Would appear not.
Okay.
7929, is that next?
No, I think that's it. I think that's everything for childcare. Did I miss anything, Rebecca?
Correct.
Yeah, we're all
No, that's all childcare.
perfect. Okay, Justin's gonna be bummed. He hates when he doesn't, when he takes off and I finish things up for without doing anything.
I'm still here.
Oh,
Uh-oh.
this was a test.
Yeah, that was a test.
And I
Uh,
failed
no.
Quick, we
miserably.
got through.
So, Mr. Chair, I have a question for you, or a comment. I just want to let everyone know that I received a request yesterday regarding a couple of our committee members being unable to participate fully on the 2nd of March. That's an important day because we have DCYF that day. So Mr. Ripple, who for some reason was doing work email at 10 o'clock at night, told me that he thinks we can work it out. And so he and I, hopefully this afternoon, will take a look at reworking the schedule. Without any commitment, my goal is to completely free up March 2nd, but we may have to jam a couple of days before then to be comfortable with that. So
Thank you for
that
that.
we'll send information on that. And Representative Nordgren?
No, I just wanted to thank you for that accommodation.
It's a simple thing. It's the right thing. Okay. All right. So you can close out if you want there, Mr. Chair.
Oh, good. So you'll move on with the next one? Is that what you meant?
I wasn't sure what the plan was. Do you want to move on to the next bureau, or was there I don't know what the plan was for your lunch break.
Jess, are you still there? Do you want us to recess now?
Oh, no, I thought you were done. I'm sorry. I'm trying to pay attention to this other committee I'm supposed to speak in.
No, I just want you to, so we finished with the numbers.
I thought you guys were done. You should finish up your slides.
We have 4 other bureaus to cover.
Right. We're finished with the numbers for that one. Now we're going to go to the next slide deck. Is that what you want us to do?
Oh, before the next slide deck, definitely go to lunch.
So recess now
Till noon. Yeah,
until noon. Is that what you're saying?
please.
Okay. So I guess we'll be in recess until noon.
All righty. Thank you.
Thank you.
Thank you. You know, I guess
then it can be there. Might want to leave it there. think so. I don't know.
Hey, Keith, can you hear me?
Yes,
So we apparently run a better meeting because the bill I was supposed to talk about at 11:15 still hasn't come up. And they've got one more bill before they get to it. So I'm just gonna have a second computer looking to see the progress of that committee. And I may cut away for 8 to 10 minutes at some
Okay.
point.
it's fine.
So Ms. Rounds, on that one slide with the workload benchmarks and the quality benchmarks,
Yes.
I really am excited about the potential for that slide.
Okay.
And so if we could schedule a meeting that meets all of our schedules, I would like to spend like 30 minutes going through that in depth and exploring its potential for other areas. So I'm assuming Mr. Ripple, you and Ms. Santinello would want to be on that call. I don't know if there'd be anyone else.
I'd like to be on it, yes. I don't know about anybody else.
I think Chris might have some of her staff join as well, but I do not necessarily need to be part of that conversation.
Okay.
So Kevin, you could reach out directly to Chris. All right, and if you're ready, we will go ahead. And I misspoke before the break. I said there are 4 presentations left. There are 3.
Okay, that's a good mistake.
We like that one.
Yeah.
All right, well, so we're going to reconvene Division 3 coming out of recess, continuing on with the Division of Economic and Housing Stability. So take it away. You're muted, Chris. Ms. Santinello, you're muted.
Dave was helping me and I couldn't find where my controls went. So thanks, Dave. Okay, can you hear me now?
Yes.
All right. I hope everybody had a nice little break. So I think we're going to go ahead and get started with our Bureau of Housing Supports, if that works for everybody. All right. So this is led by Melissa Hatfield, and Rebecca Lorden again is our finance director. The mission of the Bureau of Housing Support is to end homelessness in New Hampshire through a collaborative approach to ensure that all people experiencing homelessness obtain permanent housing and self-sufficiency. This is not in statute. It was developed by this Bureau many years ago. An overview of the Bureau of Housing Support: it assists people who are experiencing housing instability or homelessness to access housing, shelter, and other services to assist to maintain housing stability. It also provides short and medium-term rental assistance and permanent supportive housing. It provides outreach services to those who are considered hard to reach, oftentimes people who are living on the streets. And then also through this Bureau, we provide case management to connect individuals and families to services, including medical and mental health care, SNAP and TANF benefits, and other services necessary so people can maintain their housing.
Can I stop you there a second?
Yeah, sure.
I have assumed that it's my problem in not being able to find my copy of your slide deck. But I'm struggling to find my copy of your slide deck.
So Karen?
Kevin?
I think I can, yeah, I'll send it to you in an email, Representative.
All right, and then is this all three of them in this one slide deck, or are there 3 slide decks?
3 slide decks.
Okay, all 3 would be wonderful. I don't know why I can't find them. I'm sorry.
That's okay.
All right.
Okay. So here we have the number of people served for the last 4 years. And so the purple line is the total served in the state through this Bureau. And then we break it out by the different programs. The yellow is shelter, and then prevention services, and then our continuum of care dollars, and then our emergency solutions grant. We actually have refined how some of our services are provided. So you'll see that we weren't tracking the ESG services, or we didn't have them back in 2013. And so the continuum of care, I'm going to talk about all of these services, but you'll see that the majority of the services end up in prevention or within the shelter service system. The annual point in time, some of you may have heard about this, and this is actually what's done each year. The HUD, the Housing and Urban Development, requires states to conduct a point in time count every year in January. And HUD picks the date in January, and that's when housing programs, continuum of care, have to go out and physically count people who are experiencing homelessness. And so this past year, we just did it January, I want to say 27th, and we don't have that data yet. It was actually a little complicated due to COVID, but you'll see this here in January of 2020, the total number of people experiencing homelessness was at 1,675. And the blue line is the 1,327. Those are people in shelters who are considered homeless, and then the total and then people that are unsheltered is 348. So that was individuals who were not in shelter. They weren't doubling up. They may have been in a tent or living in their car, and that is the statewide number. Okay. Some of the programs that we have under the Bureau of Housing Supports is we have our programs that are done in conjunction with the U.S. Department of Housing and Urban Development, which is known as HUD. We have our balance of state continuum of care. And I'm going to talk about that on the next slide. And those projects provide permanent supportive housing, rapid rehousing, and coordinated entry. We also provide emergency solutions grant, which is homeless prevention and rapid rehousing. So it's taking people who are homeless and quickly getting them into some form of sheltered. And then we have a small program that is the Housing Opportunities for People with AIDS, which is known as HOPWA. And that's really short and long-term rental assistance. We have our emergency shelter program, which is non-permanent temporary shelter. So that's for people who have no other housing options. They'd otherwise be sleeping in a place that's not meant for human habitation. And what emergency shelter is really focused on meeting the basic needs of each person. And that is outlined in RSA 126A. And then we have a program. Yep. Sorry.
So that's all right. Representative Urf has his hand up.
Oh, I'm sorry. I couldn't see. I have too many screens going here. Sure.
It's okay. It's my job to look for him.
Okay. Thank you.
Going back to the previous slide, the annual point in time count.
Yep.
So you indicated that was January of 2020, I believe.
Correct.
Pre-COVID, I believe.
Correct.
That's a pretty substantial jump, like a 20% increase at a time when our economy was booming. Can you have an explanation for what was going on there?
Sure. So there's a couple of things that are going on there. First of all is we're getting better and better with our counting. Okay. So in January of 2020, the Bureau of Housing Support did a lot of work with all of our outreach providers, with the other two continuum of cares, to get really accurate counts. And so we've been spending a better time on collecting our data and making sure we're counting every person. So there was a huge emphasis on we need the accurate count. So that's one piece. And the second piece, and I'm going to talk about it a little bit, is while the economy is great, the housing stock, we have a lack of housing stock in the state of New Hampshire. The vacancy rate, I want to say, is at like 1.8%. The medium rent is, I think, $1,300 a month. And so housing is out of reach for many individuals. We actually have people who are working and living in shelters because they can't find a place to rent. So those two pieces go in hand.
Thank you.
You're welcome. And
So
then, yep.
I have, yeah.
Oh, sorry.
I still don't have this presentation, Mr. Ripple. I don't know if it's me, but I don't think I have this presentation.
I think it is in the email that I just sent you. I think it's the one labeled HS House Finance Presentation Final.
Okay, I checked those three, and none of those, when I open them, they don't say that. So
Did you just you did just receive an email from me though a few minutes ago though, right?
Did, and I responded, I believe, saying none of those are the ones she is sharing. I have three you sent from yesterday. However, she's on a different deck, I think.
I think the one I just sent you looks like it has 6 presentations attached. Hopefully they all attached. And there should be one.
Oh, you know what? Because I only see the 3. I don't see the bottom. I don't see the bottom ones. Okay.
You need a Dave Wieters in your house like I have.
I do. All right. So that's just me not knowing how to work an email.
It's okay. Okay. So can I continue?
Yes, ma'am.
Okay.
Sorry for the interruption.
No, it's fine. No. And so finally, the other program we have is through SAMHSA, which is Substance Abuse, Mental Health Services and Administration. And that funds our assistance, our PATH outreach, and that's for individuals who have serious mental illness. And this is a small pot of money. And so we get $300,000 a year from SAMHSA. And the services are provided by 6 community mental health centers and through Tri-County Community Action. I wanted to just take a quick second to talk about the continuum of care, because that's a little bit confusing sometimes, because the continuum of care is federal dollars, and the goal is to assist individuals who are experiencing homelessness to provide services to move into transitional and permanent housing. And the goal is long-term stability. And so New Hampshire has 3 different continuum of care. We have Greater Nashua, which is Nashua and 6 or 7 surrounding communities. We have Manchester, which has its very own continuum of care just for the city of Manchester. And then we have the balance of state, which is the Bureau of Housing Supports. What's important to know is each continuum of care receives its funding directly from HUD, and we cannot, dollars can't cross boundaries for this stream of funding. And so the goal of the continuum of care is community-wide planning to address homelessness, improve coordination, and each community gets to tailor its program to the strengths and challenges within that community. And you'll see here that the balance of state for New Hampshire, we got $4.7 million for the balance of state, and that is managed by the Department of Health and Human Services. And that is included in one of our budget pieces, but I just wanted to point that out.
I have a question on this slide.
Sure.
So when HUD sends us the money, do they send it with the housing first restrictions?
So what HUD does is they have a goal of housing first, and then we.
So that's a yes. So if they do, can we ask for a waiver so that at the discretion of DHHS, we can waive the housing first requirements?
So, and what would we want? Can I ask why we'd want to do that?
Because as I understand housing first, it says that if you have a congregate living situation where somebody is abusing drugs and is the bad apple, spoiling the whole bunch and jeopardizing the sobriety and stability of the other people in the congregate living, that the federal Housing First program insists that you leave that bad apple amongst the others, and when it may be tough love, but you got to get the bad apple out of the barrel so that the other people can survive and thrive. So it seems like a good intended program that can actually do more harm than good. And I'd like to give you the option of waiving it when it doesn't make sense.
So I think so there's a couple problems with that. First of all, HUD releases funds based on housing first as a priority. So if we were to say that, we would lose critical federal funding because we would lose points on our applications. I think while we have housing first as a goal, there also are regulations, laws, and rules that individuals must follow when accessing services. So I'd be happy to talk with you offline about this particular situation you might be talking about to see if we can clear some of that up.
Okay.
Okay. Great, thank you. Yeah, okay. So this is the delivery system. You'll see we provide services statewide, and we have a number of providers that we contract with, and some of these providers provide multiple services. But I broke it out by the different program areas. One of the accomplishments that we have through this past year, a couple of years, we actually really have implemented for the balance of state. So I just want to be clear, this is for the balance of state, but we implemented a coordinated entry process that standardizes access for individuals who are at risk of homelessness and experiencing homelessness. This has really helped individuals and families access housing services that they need. And it also enables us to prioritize those who are the most vulnerable to get access first. Also, in fiscal year 2019, we were awarded 3 new programs: rapid rehousing for Stratford County, statewide community entry service system for survivors of domestic and sexual violence. And we were able to expand permanent supportive housing in the North Country. So we really tried to target areas that there were gaps in the state and how we could target that. And through the work with the Council on Housing Stability, we're partnering on submitting a 1915I Medicaid state plan amendment. And this will enable individuals who are experiencing homelessness that have serious mental health diagnosis or a substance use disorder obtain and maintain permanent housing. So we're still finalizing that actual submission, but this will be a way to provide access to individuals to maintain their housing, which we're really excited about. And then we also are looking at creating a comprehensive case management model that follows the person throughout the process of experiencing homelessness or housing instability. So if somebody starts an outreach, goes into a shelter, and then we can move into permanent supportive housing, the case management will follow the person and connect them with the necessary services. And then finally, we have partnered with our public housing authorities, and we've expanded voucher programs in New Hampshire. So the first one was mainstream vouchers, which provides rental assistance to non-elderly individuals with disabilities. So this will actually help because it moves people that may be getting permanent supporting housing into the public housing waivers and vouchers, which will free up beds for other individuals. And the same thing for youth who have left foster care, who are homeless, some housing vouchers to help them become stable. Challenges we have here, and I touched on it a little bit, is the lack of affordable housing. New Hampshire vacancy rates are 1.8%, so that's really low. The data I have is that in Sullivan County, there's a 0 vacancy rate. So it's really hard for people to move out of the shelter system. It's a backlog because there's a lack of affordable housing for individuals to move into. One of the other pieces is, I mentioned the rent. Rent is $14.13 a month for a medium typical 2-bedroom apartment. And that includes utilities, but that's still out of reach for many individuals and families. We use state general funds to support the emergency shelter system, and we reimburse them at a cost of $8.80 a day when the actual cost is $47 a day. And then finally, I think the way we access the way dollars flow in, federal funding is extremely restrictive and siloed. So it really limits the ability for people to be flexible and creative when trying to find solutions for homelessness.
Is there a set of waivers we could be asking for to liberate some of
Yeah.
those?
So one of the things we're working on actually is, I'm glad you asked that, is the Council on Housing Stability is really looking at what are some solutions and how can we, one of the goals is to look at how can we eliminate homelessness. And then another piece of it is, what do we need to look at as a state? And so we're really, it's a very broad council. We were formed under Governor Sununu executive order in I think November. And so we're starting to delve into all of that and really understand the silos, and are there ways we can apply for waivers, restructure how we do things. So that's something that we're looking at, and we have a report that is due in June. So hopefully we'll have some strong recommendations that come out of that.
And in your housing program, are veterans treated like every other client, or are there special categories for veteran services?
There's actually some special funding and special programs for veterans, and there's a very large veteran network.
Representative Wallner has her hand up.
Okay.
Thank you. Chris, this sort of goes back to the slide before, and maybe you have a slide coming up that has more detail, but I was wondering about homeless youth and young people who find themselves homeless, and what kinds of programs, do we have specific programs for those people? And
yeah,
how many young people do we have who have left foster care that are being served by one of your programs?
So I do not have that data handy as to the number of youth, but I can actually get that information for the committee. I'm going to go back because we actually, and I can get the information as to how many youth are participating in the housing choice vouchers. We actually statewide, we have one rapid rehousing project for youth that are experiencing homelessness. And I believe we actually have, under our prioritized needs, expansion of that program. And we're also applying for the youth homelessness demonstration project through HUD. We applied for it 2 years ago and we were not successful, but we are geared up to apply again as soon as HUD releases that that RFI or RFP. But I can get you that data.
So could I just ask one more question?
Yeah. Yes, ma'am.
So I see what I saw on that slide about the young people coming out of foster care was that they get a voucher. How much is the voucher for? How does that?
So that is based on income, and so I will get you the exact dollar amount. I'm not sure. It's Section 8 housing vouchers. So I don't have that off the top of my head because we don't administer that, but I can get that for you.
Okay, thank you. Thank you.
You're welcome. Okay. So here's your favorite slide, Representative Edwards.
I think I am going to love these.
Okay. So one of the benchmarks that's looked at is HUD expects a reduction in the average length of that people experiencing homelessness. Okay. So in fiscal year 18, it went from 3 days to fiscal year 19, it was 83 days. And so what we find is that as the vacancy rate decreases, level of stay increases, right? So that's what I was talking about earlier, is the number of people stay in shelters longer because they can't get out and find affordable housing. And so that's a real issue that we have, because we're held responsible, for these benchmarks, but yet we don't necessarily have access to all of the housing units that the state needs. And so that is another area that the Council on Housing Stability is looking at, is how do we increase the housing stock, because that is what's going to end homelessness with the supportive services for a large majority of people. HUD expects that income for people who are experiencing homelessness goes up, and we show that from fiscal year 18 to 19, we went up, the income went up. So that's a positive thing. And that we have to look at the number of people experiencing homelessness from 18 to 19 did decrease. And they expect us to do that for the first time. So that's first time homelessness, not chronic homelessness. And so what's important to know is that with all of this, the fact that housing is hard for people to access, this impacts all of this.
I don't see any questions. You can.
Okay, all right, great, thank you. This is just an overview of our budgets. The majority of our funds are in federal funds, and a small amount of, you know, our request is higher for general funds, but we do get the majority of our funds in federal funds. So what would we do if we had 5% more? We would increase funding for shelters. You know, they have a really hard job, and so we really need to provide them with the resources they need so that they can support individuals who are homeless.
When you say increase funding, would you change that daily rate from $8.80 a day to something higher?
Yes, we would. We actually put that in our prioritized need. We did not jump up to the $45 a day, but we did put it in. I'm trying to pull it up. What it is, we would increase it to $20 a person a night. So
you're sure that would create more beds, or it would just take pressure off of the not-for-profits that are probably coming up with the rest of the money?
It would do a combination. We would look to really have them increase their capacity to serve people that are there, provide more extensive services, but it also would enable them to strengthen their operations. We would also look to expand and leverage federal funding to increase populations for unserved populations. We'd increase some street outreach and youth services, as well as enhance our case management. And then the Medicaid supportive housing benefit is going to help us to fill gaps. I think sometimes landlords may be reluctant to rent to somebody who is experiencing a mental health disability or substance use recovering. But if they know that there's supportive services around the person, they may be more apt to rent to an individual. And then if we had a decrease, I think there's some smaller shelter programs that are really getting by, barely getting by, and some of those would close. They are dependent on volunteers, and so a lot of them are barely making it by, so that could have them close. And then eviction funding, if we had a decrease and we had to reduce eviction funding, that would really impact people becoming homeless. We want to try to keep people in their homes when at all possible. Is there any questions on this?
Oh, wait, there's one.
Okay.
Representative Wallner.
Okay.
Just one.
Yeah.
2 years ago, when we were meeting to go through the budget, I found the eviction prevention program to be one of the most interesting programs I think that we were doing at the time. And because it keeps us from having people become homeless.
Right.
And how are we doing on that program, and how many people are we serving at this point? Do you know?
So it gets a little, so we've actually, done a lot this past year, especially with COVID, right? And so I can actually, I don't have it off the top of my head, but I can provide you with the numbers we assisted people with pre-COVID, and then the numbers we did during COVID, because, we had a number of funds, especially those from Gopher, to keep people in their homes, that was COVID related. And I think off the top of my head, I think we assisted like 4,700 individuals, just with that program. And so one of the things we did over this past year is we've really leveraged all of the additional federal dollars that have come in to the state, and really moved our dollars more towards how can we access the federal dollars first to keep people in their homes. Because you are absolutely correct. We want to try to keep people in their homes and do what it takes so that people don't experience any homelessness. But I can get you those numbers.
Thank you. It seems like such a good use of our limited resources to try to keep people from ending up homeless.
Right, and that includes, that's children and families, and the stressors of moving, and it's hard to find housing. And so how do we keep people where they in their secure housing?
Thank you.
Yeah.
Well, and it also sounds like this is a landlord assistance program, right? I mean, because the money that you're investing is going to the landlord, so that the landlord has less reason to evict someone.
Correct. Yeah, money goes directly to the landlords, and so yeah. But we also want to try to make sure, not all eviction is related to funding. And so while that's a critical piece, the supportive services are essential to keep people, to maintain their housing, and to provide the tenancy supports that somebody needs to be successful. Anything else on this slide? Okay. Whoops. So then these are just the accounting units we have within the Bureau of Housing Supports. And I think now we're going to go over the actual budget book, or the, accounting book.
Yes.
Is that, did I say it right?
Try to find it on my spreadsheet. Okay, so I found Path Grant. Good. This is good.
Okay,
Karen, it's page 966.
great. Perfect, thank you. So the first accounting unit that shows on page 966 is actually one that we're no longer using, which is 7925. And Chris or Rebecca, could you just let them know why funds are no longer budgeted there? Do we budget somewhere else?
I'm just pulling it up, actually. This is, oh yes, we actually moved that into 7927, because what we wanted to do is actually have it be more of the eviction prevention program. This is, again, one of those programs that was siloed within our own department, and so we want to move it under eviction prevention.
So we'll talk about that on the next page. So accounting unit 7926 is the PATH grant. This is 100% federal grant. Any questions on that?
Well, I feel guilty not asking you any questions just because we're spending federal money.
Well, you asked me enough questions, so I think I can take some for Karen.
One thing I will mention here, actually, while we're on this grant that's 100% federal, something that you're going to see throughout the budget is this change here with funds that are here in class 102 and are now in class 74. As Meredith spoke about, we have to do subrecipient monitoring. So they're not just considered contractors, there are contractors who also provide services on our behalf. And so to better track those in the accounting system, we have moved those to class 74. So you're going to see that throughout the budget. Okay. All right, not hearing any questions. I'm going to go ahead and go down to 7927, which is the housing shelter program, which also continues on to page 968, which is where the bulk of the expenditures are, is on page 968.
We have state money here, and
Yes.
it looks like the state money from the prior budget, 2-year budget, is dropping significantly. Is that a correct interpretation? And if so, what's happening here?
Yes, Rebecca, would you speak to that?
So in this current biennium, we were given additional funds for some of the programs. I believe it was some for eviction prevention, rapid rehousing, outreach, shelter funds. But because of the pandemic, we weren't able to move forward with all of it as we had intended.
Okay, so
Those are a prioritized need for us because we know that the federal dollars will run out and we will need those dollars.
it looks like in the budget, though, under the shelter program, we're expecting a nice, huge jump in federal funds. So I'm confused by that statement. It looks like our federal funds are going up significantly and our general funds are going down in the shelter program.
Just give Rebecca a minute to pull up that information.
Like, for example, in FY93, it's 7.9 million for the feds, and it's like 3.6 million for state.
Yeah. I think the federal programs that Chris was speaking about too was the CARES Act federal programs, which don't happen within this accounting unit. They, when we're appropriated CARES Act funds, they're elsewhere.
I assume this is a match requirement of state money to get federal money? Or is that a bad assumption?
Oh, I'm sorry. To go back to your question, this accounting unit had been under budgeted with their federal dollars. So each year the grant was just level funded for the budget. And now that the programs, we're working better to work with the vendors or the shelters and stuff to spend down the dollars. And there was some staff turnover and we've made some really good changes that we are able to utilize the full grant. So we have increased the budget for the next biennium.
So that sounds like good work.
Yes.
Is there any way we could go back and ask retroactively from previous year funds?
Actually, what we've done is the funds are good for 2 years, I believe. And so we're spending the oldest dollars first. So we're able to carry those into the next biennium, where we actually have just gone to increase the federal dollars for the current fiscal year that we're in.
Thank you.
And I just want to clarify that the federal dollars don't go to the shelters. Those are funded with state general funds. And so when we say housing shelter program, lots of things are included in this budget line, but I just want to be clear of that. And then there is a requirement that HUD has that the subrecipient agencies, they have to provide a match.
Okay. And you can tell me offline what the match requirement here is. Representative Wallner, General Wallner now has a question.
Are there any other questions on
Yeah,
7927?
Representative Wallner does, yes.
Yeah. Thank you. So something that Rebecca said reminded me of a question. It's really a question for Karen, and it's beyond just this page in the budget, but
Sure.
like you said, that there were a number of programs, it was some in this area that really never got up and running because of the pandemic. And so we must be lapsing quite a few funds. And I wondered if, Karen, if you could provide for us a listing of all those of the programs that we are lapsing funding from. The ones that didn't get up and running and the ones that got up and running late in the budget and then ended up having funding left in their lines.
Sure, I think I can definitely provide that for fiscal year 20. I'm actually working on a similar request for the fiscal committee for exactly that. I mean, you will also see it as we go through here, as you see a difference from actuals, presuming that fiscal year 21 budget was similar to the fiscal year 20 budget. For fiscal year 21, of course, we're, only not even quite 3/4 of the way through the year. So what we have are really estimates, and a lot can happen between now and June. A lot could end up contracted between now and June. So I am working on a similar request for the fiscal committee, but at a much higher level, just giving a sense of what is staff lapse versus programmatic lapse. And I can also provide that as soon as we have it. The other thing I would just mention, I know that some may be thinking, okay, the pandemic started 9 months into the fiscal year, but I would just remind everyone that the budget did not pass until October 1st.
Right.
So it was only about 3 months into the fiscal year when the pandemic started. So people were just starting to, be in the planning phases and work towards RFPs when the contracts unit started writing about 400 or 500 additional contracts.
Right.
Well, and at the same time, there was a limited number of providers that could respond to RFPs because they were so involved in the pandemic.
Yes.
Thank you. Well, I think that the information you're providing to the fiscal committee would be really helpful for this committee to see that same information about which programs are lapsing funding. And I assume that we'll have an explanation of why they're lapsing it.
I think that the explanation across the board is the pandemic. I don't think that there's much of any other reasons other than that.
Okay, great. Thank you.
Any other questions on 7927? Okay. Then I believe those are the only two accounting units for this area. So I'm going to go ahead and stop sharing and turn it back over to Chris for the next area.
There's a question with Representative Nordgren.
Yeah, thank you. Just going back to Mary Jane's question. So with the lapses you're anticipating, and obviously it was last fall into this year, how did that impact the governor's budget preparation? Do we have any indication how that influenced any of the decisions made for funding for the department, or where's that money going?
I do think that that's probably a question you would need to ask of the governor's office. I'm not sure how our lapses impacted their decision-making. I don't know that I have an answer for that.
Well, that triggers a question in my mind. When you work with the governor's office, what human is that? Is that mostly Chris Elms, or who do you work with?
No, the governor's office has a budget director who is Matt. I'm going to say his last name wrong, so I'm Meliu, I believe. So Matt, I believe Matt presented to full finance last week, so he would be a good person to reach out to from the governor's office.
Good, thank you. Any other questions?
I'm going to unmute you. We are going to go to the Bureau of Child Support. Can you see my screen? Okay, great. Thank you. I'm going to try to do this without having Dave, because he's in another meeting. So the mission statement for the Bureau of Child Support is that it encourages responsible parenting, family self-sufficiency, and child well-being by providing services to locate parents, establish paternity, establish, modify, and enforce support obligations, and obtain child and medical support for children. One of the pieces is this, while each state has its own mission statement, they all are very similar based on guidelines from the Office of Child Support at a federal level. And then we end up putting that into our child support state plan. Okay. The overview is that child support was created by Congress in 1975, and it ensures that children in single-parent households receive a reliable source of private financial and medical support. We serve families from all socioeconomic backgrounds, and actually we reach approximately 1 out of every 6 children in New Hampshire, and on average disperses about $83 million a year to families. It is one of the largest income support and anti-poverty programs for children. It reduces a family's need for public economic assistance. It's been shown federally to prevent child maltreatment. And with this program, we have a 66% federal match. And then plus, which I'll get to later on, there's certain outcomes and how we perform with those outcomes, we actually can receive additional federal dollars.
So I just have to tell you, the number 1 out of 6 is just really disturbing to me. But that's just a comment. The line above that, where you say you serve all socioeconomic backgrounds, the word "all" I stumble over that, because I would imagine there are income thresholds, and not all economic levels qualify.
So we don't have people qualify if a family has a child support order through the courts. They can qualify. If a family says it's much less stressful for me to have the Bureau of Child Support collect the child support than me doing it personally, they can qualify for services. It's not an eligibility program. It's an access to resources. Does that help?
Yeah.
Okay.
I was having a hard time imagining well-off couples or partners needing the help, but
Oh, it's not necessarily the money. It's actually getting the resources. So if you are in your relationship ends difficultly, and it can be a control thing for one person to control funds over another person, and this actually takes that out of the equation. It also assists with maintaining an accurate accounting of money in, so they can clearly say how much money was given in child support. And there wouldn't be any questions because we're a third party.
No, this is just so horrible.
Huh?
No, I think it's just horrible that we got 1 out of 6 kids tied up in these kinds of situations. But again, that's
We're
an
getting,
editorial
but we're
comment.
also, yeah, but we're also getting $83 million a year to families, so that's a really positive thing, right?
I'd rather have every kid happy and not needing the program. But
Well, but
anyway,
this, yep, all right.
it's all editorial. Please continue.
Okay, thank you. Here's our caseloads. We do them every year in September. And you'll see actually we had an increase in 2015. And that was really because we had a new data system. But really, our numbers have declined. So I guess you'll be happy to hear that, Representative Edwards. But I think 2 things have caused our caseload numbers to go down. The first one was we had really high workloads prior to 2017, and we spent a lot of time on leaning some of our processes, really looking at case management models and really closing cases that people didn't have time to close that we really should have closed. So we really went through and updated our processes. And then secondly, we had a new agreement with Medicaid. In the past, Medicaid was referring tons of people to child support who didn't want child support services. And so we really refined that policy so that only appropriate referrals come in. So child support was spending a lot of time with families who didn't want the services, and so that impacted our caseloads. And then we also were able to close a lot of cases during COVID because there was also a decrease in having to go to court cases. They were able to do stuff telephonically, so that reduced some of the drive time, but also the Medicaid referrals really helped with bringing down our numbers. Okay, any questions? Okay. There's some key stakeholders, I think, that's really important to outline for the Bureau of Child Support. We work very closely with the New Hampshire Judicial Branch, who establishes the legal orders. They establish paternity. Often, if an order needs to be reviewed and modified, that's done, with the judicial branch. We work very closely with employers to verify income and healthcare coverage, to garnish wages, and then to assist to enroll children in healthcare. And then we work very closely with other non-governmental agencies. We work interstate and international to collect child support dollars for families. And we work with our federal office and national associations. Okay. We provide our services across the 11 district offices, and then we have a centralized intergovernmental and legal unit, as well as customer service. We use technology, enforcement, and case management, and we are required to disperse payments within 48 business hours of receipt of those payments. We have to work closely with our stakeholders, employers, and then we use methods of establishing legal fatherhood, including genetic testing. We also will provide a cross-state collection if one parent resides in another state or country. Some of our accomplishments is we're cost effective. We collected nearly $89 million in federal fiscal year 2020. And for every dollar that is spent on services, $3.93 is collected for families. we have positive outcomes achieved by children because we are able to address individual needs. The services reduce public assistance and prevent child maltreatment. We also developed and implemented a 5-year strategic plan. And during the pandemic, we really increased performance due to the court's electronic methods. We were really able to continue services uninterrupted. And we, as the courts were continuing to process child support using telephone and video methods, it actually resulted in an increase in participation between parents. You would actually not think that would be the case, but parents who had to pay child support didn't have to take an entire day off from work to sit in the courthouse. They were able to have a telephone appointment, and that process really worked on increasing the number of orders that were established. So that's one of those silver linings. Some of our challenges is current economic conditions, because high unemployment may impact certain businesses. So people will actually maybe make less money, and that'll impact child support that is given to children. A challenge is always figuring out, how do we improve the customer experience? How do we use more technology so that we're able to get at people that don't want to make an appointment, that want to do things online? And really, how are we always looking at, how do we improve our performance with process improvements, automation, that really is going to help us increase capacity in our performance. We do actually have certain performance levels, and this is, child support nationally has an incentive system that measures your performance in these 5 areas: establishment of paternity, support orders established, collection of what's owed, cases paying in the arrears, and cost effectiveness. And so because of this, we actually exceed national benchmarks. And so each year we receive financial incentives for this. And this has been, and then we're able to reinvest those dollars into our child support program. So this past year, we were able to use some of our incentive dollars based on exceeding expectations in these areas to assist with some of the equipment staff needed to work remotely. And so it's a great way because the states actually get rewarded for doing good work.
That's great. We have Representative Earth with a question.
Oh, I'm sorry.
Hi, going back a few slides to number 8,
Yeah.
which shows your district offices. I'm just wondering, is this another unique set of district offices, or are these overlapping with some other operations as well?
No, so we use our district offices that we have across the state. So our staff are housed in our district offices.
When you say we.
Oh, I'm sorry.
Yes.
DHHS, yes. So in our district offices, we have child support, adult protective services, DCYF, the Bureau of Family Assistance, and the Bureau of Employment Support. So we're all housed in those offices.
Okay. Now, do the IDNs come under DHHS in terms of are you sort of responsible for them?
I'm not responsible for the IDNs. No, that would be under Medicaid and behavioral health. And they have 7 regions, right? It's how many regions does the state have to have, right?
Okay, but my question is, so when you answered the question about what you have, you just meant specifically beneath you. I'm talking about HHS as a whole. How many different combinations of mappings do they have, if you will, to the state?
So I'm gonna look to see if Karen is still on. The areas that I use primarily follow district office catchment areas. But there are a number of the public health, which they'll talk about, has public health networks. The area agencies and community mental health centers are broken up into 10 areas.
Okay.
I think the physical locations of our offices in the state are the district offices, and those include staff from this division, from DCYF, from Division of Long-Term Supports and Services. The contractors that we have, or the subrecipients that we have, they may have different catchment areas or different models that cover different areas, like the public health networks or the DD system, like Chris mentioned, but they do not utilize our district offices with their staff. They have their own offices with their own staff. Our staff are at the district offices.
Okay. So there's no way to make them not necessarily identical to you or whatever it is, 11, but to follow the same lines?
So that is a larger question. I wish you had asked that when the commissioner was here.
Yes.
Something that she has some strong feelings about as well, and something that she would like to have the department look at in a strategic planning,
Okay.
in a strategic way. But that's not something that's, uniform right now.
Well, I know that. Thank you.
You're welcome.
So this here actually shows you our different performance measures in the different areas that we talked about on the previous slide. And I wish that we actually had a side-by-side on this one, so you could see that, this is our increases in the paternity establishment, that actually, while our numbers went down a little bit in this past fiscal year due to the pandemic, we still were higher than national standards. And so for a period when some of the offices and, out laboratories and stuff were closed down, our numbers went down a little bit. But we still exceeded performance nationally, which is extremely beneficial because some of the other New England states weren't as successful as we were, and they actually are going to be losing some dollars based on that. We actually continue to increase support orders and child support paid. So we did actually receive more money in fiscal year 20 because of some of the economic impact payments. We were able to assist that with payment of on the arrears, as well as unemployment benefits. Any questions? Okay.
And maybe I got a little question here, right?
Okay.
The calls I get that have the most emotion and passion in them are the calls that are related to people caught up in the child support system, and they're going to war with their partner over things related to the kids. What decisions of the court, decisions of DHHS, complaints that a paternity test was established on one kid, but not the other three, stuff like that. So I'm just curious if there's a metric or any tracking being done on customers, I hate to say it that way, but customer satisfaction or the extent to which, because I saw that was one of your challenges, something you want to work on, but are there any measures in place to sort of track satisfaction with the system?
Yep. And so that's something we always want to look for. And, and one of the pieces is, we don't put the orders in place, right? We are enforcing some orders that are done through the court system. And oftentimes there's lots of emotions and there's lots of complicating factors. Our current IT system does not allow us to track customer satisfaction. But that is one of the things we're looking to improve with some of our incentive dollars. Karen, who is the bureau chief, and I have talked, and that's one of the things we want to look at with our incentive dollars. Also, the child support guidelines, that's done through rule and statute, and so it is something that we need to look at holistically and all the pieces.
How are your employees doing in this area? Is this an area where you have a lot of attrition, a lot of stress, a lot of burnout, or are they pretty well shielded from the public sentiment?
So again, it is a stressful job, I have to say, but they are very dedicated and very committed to the goals and the outcomes of the child support program. We provide a lot of support to them, and there's very little attrition within this part of the division. Yeah.
Good. Thank you.
You're welcome. Okay. This is just a little bit here about our funds. Like we said, it's 33% general funds, the rest are, or 34%, sorry. General, the rest is federal dollars, and we have a small amount of other funds, which is our incentive funds.
So this trend there is showing that we're increasing the percentage of state dollars over each budget, and our federal money isn't growing as fast. So what are we doing here?
You crossed out on, went out on me a little bit. Some of the federal dollars, and I'm going to defer to Rebecca on some of this, is that we actually are budgeting less incentive funds so that we can use those as we move forward. That was one of the pieces with our incentive funds, and I'll let Rebecca talk about that a little bit. And then some of the spending we had with our incentive funds because of COVID delayed some of that work. And so some of that is being moved forward into our next fiscal year. Rebecca?
Did you still have a question, Representative
Well,
Edwards?
I guess I'm just looking at the three bubble charts here in the red, and each budget we're increasing about 1.2 million or more each year, and so that's a pretty rapid, significant increase in state funding, and I'm just curious what's driving that growth rate.
So there was, I think it was this biennium, our Nexus system wasn't supported through the capital budget. So the prior biennium, we used incentive funds to keep enhancing the system. And this biennium we're in, we switched those dollars so that it was general funds and the federal funds instead of using the incentive dollars, so that we could use the incentive dollars to try and enhance areas that we weren't able to do previously.
So it almost sounds like you're describing these incentive monies going somewhere where the legislature doesn't have visibility over it. So, but I'm sure that's not true.
That's not true. I think it's really trying to, it's trying to do things like we talked about with customer satisfaction, and really not have it be for general operations and maintenance of the system. And so by including some of the Nexus into our our maintenance and operations, we're able to actually get some of the 66% federal match on that, which is very helpful.
The incentive funds are not supposed to supplant funds. It's supposed to be able to enhance the program.
Okay, any other questions?
Yes, Representative Burke has one.
I'm having a hard time hearing. Okay.
Yeah, she's talking about me. I have two questions. One on the previous slide. Can I just assume that bigger percentages are better back on the key performance indicators? I'm just not sure what IVD PEP means.
Oh, sure. Yep. It's it goes to establish. Yes, absolutely. That is the paternity establishment, and then the next one is establishment of the court orders, percent of child of received, paid, and then the percent we're paying on the arrears. So it's our yeah. I can send you the actual acronyms. I apologize.
No, that's okay. I think I have the list. I just didn't recognize.
Okay. Yeah.
But my real question is on your current slide,
Yep. This one.
that one. I'm looking at the spreadsheet, not the book. So maybe this shouldn't add up. But you show, for instance, 22, 23, 9.9 million for general funds. And the general funds, and I assume that's the budget, correct? Your budget amounts?
Rebecca. Yes.
So I
Yes.
see 4.0 roughly million in 22 and 4.3 million roughly in 23, which is way less than 9.9. I'm just wondering, am I missing something?
This is the agency phase request. The budget was reduced. There's a couple of unfunded positions after the governor's phase.
Okay, so here's another question for you then. Same question, but for the previous, so for the current biennium, 2020 and 2021, you show up 8.4 million, and yet in both years in the governor's budget for showing the actual 20 and the adjusted authorized 20, they're less than 4 million each. So a total of under 8 million, in other words. I'm just wondering again, what?
So we took, so for that chart, it's the actual for 20, and then 21 is adjusted authorized.
That's what I gave you. But the adjusted authorized is just under 4 million, 3.978. And the actual in 20 is 3.841 million.
May I ask, are you looking at one accounting unit, or are you looking at the whole program?
I'm looking at 7929. Is that should?
Okay. There's more programs with that. There's, I believe, 4 accounting units that make up the total.
Oh, okay, that weren't included in this presentation, right?
No, all 4 of the accounting units are on slide 15.
7931 and all that. Okay.
Yes.
All right.
Yes. Yeah. So this represents all 4 of those.
Okay. Thanks.
I don't know if this matches up against the what's in the spreadsheet for the budget, because I'm looking at child support services in the spreadsheet, and in FY 22 and 23, the general fund is 4.084 million, and then the next year is 4.275. So that's about an 8.3 total, but I'm seeing 9.9 in the red there in the bubble chart. So are these, did the numbers match, I guess is the question?
I think that's the same thing that Representative Erf was speaking about, that you may just be looking at one accounting unit. All 4 accounting units totaled, even in the governor's phase, are 9.2 or 3 million.
Okay. So the issue is with the headline of this slide where it says Bureau of Child Support Services budget. It's more than just this activity name, Child Support Services.
I just figured it out. It's actually the column before, which says Child Support Services, basically has 4 components, of which we were looking at one of those 4, which also has the same name, Child Support Services.
Correct.
Those kids, they need a lot of support.
Right.
All right. Very good. Thank you.
Okay. So again, the 5% increase decrease would be we would obtain better outcomes for children, meaning getting more resources for children, reach parents who are not yet using child support services. There may be some parents who are in need of the services that aren't aware of it, and really look to enhance our tools for better customer service so that people can do more stuff online, off hours, and do more self-service. A decrease would be a delay in families' receipt of needed support. We also would risk not being in compliant with our federal timeframes and other requirements, which have financial penalties, and then also fiscal penalties for poor performance if we don't pass our data reliability audit. And also, earlier I talked about the incentive funds. That is really additional dollars that we use to do some of those enhancements to our service delivery system, and that would be impacted.
Okay, so from my previous comments,
Yeah.
this line that says obtain better outcomes for children, if you could somehow make that measurable.
Yep, I will do that. Okay, and we will get that
Sounds
to
like
you.
sounds like you added a fourth decremented budget outcome by saying we might miss out on federal incentive money.
Yes.
Or is that really your third box?
That really, falls into the third box. But and we will provide all of that to you in writing, because I think it'll be easier that way, definitely. You're welcome. And then these are the accounting units that make up those circles 2 slides ahead. So that we'll walk through that when we go to walk through the budget book. And then here's just a breakout of the staff. We have 127 positions. And this is how they're broken out by program support, supervisors, and child support officers. Okay.
How's your voice holding out? You've been talking a lot.
That's what I do. I'm Italian, so I talk really well, I have to say, and I can go on, and you can't even see my arms moving all the time. So you're really lucky at that point. So I'm going to now turn it over to Rebecca and Karen, and I'm going to have some water, I think. So.
Page 969.
Need to be off mute. As you saw in the presentation from Chris, there are 4 accounting units in this section, starting with 7929, as Rebecca just started, starting on page 969.
So I think I have a question here. I'm looking at expedited IVD services, and it looks like we're getting federal funds of just under 900,000.
Are you?
And then
I think that's a later accounting unit. That's 7934.
I jumped ahead to IVD. I'm sorry. It jumped out at me.
It's okay.
So we don't spend any state money on paternity tests. It's all federal. Is that, am I reading this spreadsheet correctly, that the IVD services, their funding is all federal?
Yes.
Are you looking at the accounting unit 7934?
Yes.
That's actually, that's for the courts. It's, we have a contract with the Administrative Office of the Courts for the marital masters. They hear cases and they get reimbursed for the federal portion. So it's 100% federal.
Could have sworn earlier on the performance slide with the bar graphs that IVD was for paternity testing, but that's okay. I'm just a little confused because I thought IVD on the bar chart was, yeah, right there. I thought we heard
I
this.
think
That's what it's
that
referred to because it's the title of the Social Security Act. So a couple of pieces are, it governs the program for us. So that's how they refer to it.
All right, so maybe somebody in the committee could train me later because I'm confused. It looks like this is all money to pay the court for the court activities, but in the performance chart, it was described as paternity testing or paternity establishment. It's not a lot of money and it's federal, so let's move on. It just seemed like we're using different descriptions of the same letters.
Can I ask a question?
Yes.
What are indirect costs, line 40?
I believe that Mr. Ripple provided the information from Department of Administrative Services on class 40.
So I haven't sent that along yet. I'm going to send that in an email to you all later today. It may be posted to our website, though. I'm not sure yet.
It is posted at the website.
Okay.
And perhaps related to Justin's question, is it possible that there's some of that paternity stuff in the main 7929?
Rebecca, do you know exactly what class line we pay the
Yes.
paternity test out of?
we do pay it out of the contracts line. And some of it, it's paid out of 102.
Does that make sense, Jess?
Yes. So we don't spend any state money to establish paternity. Is that a true statement?
We do pay the 34% general funds, and then it's 66 matched federal.
This accounting unit 7929 does have general funds in it.
Ah, all right. Very good.
Any other questions on 7929? Okay. The next one is 7931, which is the state disbursement unit.
What is that?
Rebecca, who do we contract with for
Sure.
this?
Is it Conduit? I believe.
Trying to unmute myself, yes.
Okay,
it is
Conduit.
Conduit.
And they
It's-
disperse the funds. They receive them and disperse them.
We're required to have that a place where funds are received, dispersed, and distribute the payments, and it interfaces with our child support system.
So is that a cost or just money flowing through?
It's a cost to pay the contractor to transfer those funds.
And which funds are they paying on? Across the entire department, or?
No, this is just the child support funds. Chris, how many millions a year are paid in child support?
Like $83 million a year.
So this is the IT system to manage making those $80 million a year in payments.
Okay.
Within 2 days of receiving them.
Oh, that's what you're talking about with the high turnaround. I got
Yep.
you.
Yep.
Okay.
Okay. All right, moving down to 7933, access and visitation. It's a $100,000 federal grant.
Okay.
And lastly, in child support is 7934, which we were just speaking about earlier.
questions? I don't see any.
Okay.
Hey, Jess, just so you know, when you turn to the side there and kind of move your head a little bit away, we lose you auditorially.
I should lean in like this then?
You don't need to lean that far in. It's just when you sit back and turn your head that we kind of lose you.
Okay, thank you.
So, Chair, if I might, is it possible that I could request a 5-minute break? This last presentation is about 25 slides and it's about 15 accounting units. So I expect it'll take more than an hour. So I'm just thinking it would be good
5
to
minutes? Do you
take 5
want
minutes.
10? How about 10? Let's take-
Great.
So we'll come back. It's 1:26. Let's come back at 1:35. Recess to 1:35. Hey, Representative Murph, you got your hand up. Did you have a question to start when we get back from recess, or is that now?
No, I just put that up. I just want to ask Karen a quick question if it would, before we start the next one, if you don't mind.
All right.
Sure.
The ones in a lot of the fields in the 79, 29 we just looked at, what are those? $1.
79, 29.
They're
So,
placeholders.
yeah, they're just placeholders so that the class lines don't have to be created. If they're budgeted at 0, then the class lines have to be created to transfer funds into them.
So is that another way of saying that if there's zeros, they go away?
Yes. And then we have to get them recreated, which creates some problems. Rebecca, correct me if I'm wrong, but I think where we did do that, we budgeted $1 as a federal dollar as a placeholder, not a general fund. Correct. Okay. Yes. So if you eliminated those, it would eliminate only federal funds. There's no general funds in those class lines that we budgeted at $1.
You mean there's never general funds, or just in right now there's not?
Right now there's not. When we use the $1 as a placeholder, we budget it as a federal dollar as a placeholder, not as a general fund.
Right, but if you go to use it, you could put general funds into it.
Correct. But they would have to come from somewhere else. So they would get transferred from a different line.
Right. Yep.
Yes.
Senator Wallner, you had a question? I guess we're out of recess and we're running again. Go ahead.
No, I just picked up, my husband just picked up my mail, and in the mail today was the budget briefing book that I assume Karen put together, and I just want to say thank you, and it looks really very thorough and has lots of good information in it.
You're welcome.
It must be a lot of work.
I pass that thank you on to the directors and the finance directors who worked on that. It was very much appreciated. We were not able to provide one for the governor's phase, so I'm thrilled that we were able to get one for this phase. So it's
really helpful. Thank you.
You're welcome.
Okay, so Ms. Santinello, how are your arms? Are you ready to start waving your hands again?
I am, and here I go. So we are going to do the Bureau of Family Assistance and the Bureau of Employment Supports together programmatically. They are separate, but they are very closely aligned. And so because of how the money flows and all of that, it makes a lot of sense to do them together.
Representative Wallner still has her hand up.
Okay.
Did you have a question? Go ahead.
Okay, great. So the mission statement for the Bureau of Family Assistance, which was made by the team, it's not in statute or rule, is to provide value services and supports to assess children, individuals, and families towards upward social and economic well-being, to overall decrease the need for assistance by providing services and supports in the areas of employment, family well-being, and barrier removal. And with the Bureau of Employment Supports, it's really to assist parents with upward economic mobility by promoting work through the provision of employment support and training services in an effort to strengthen families and improve child and family well-being. Again, this was done by the team, not by statute or rule.
So when we get into the right spot around that, would you make sure I understand the distinction between your role and the rollover in DEHS or whatever the employment services group is? Because they have a training responsibility.
Yep.
I think statewide we have 12 or more training programs.
Yep.
To help them.
And so I can get into that a little bit, but Rich Lavers and I actually, we work very closely, and our end is, while it is on some of the employment pieces of it, a lot of it is barrier reduction, and so providing some of the supports so then somebody can participate in some of Rich's programs at Employment Security. And he and I have talked a lot about, and unfortunately COVID kind of really, got in the way of doing some planning, is how can we bring our services better together and streamline and build off of the strengths of each and not have duplicative services. So that is definitely on my radar.
So the term barrier support or removing barriers, I think has shifted over the last.
I can't hear you. I'm sorry.
Oh, I'm sorry.
That's okay.
I said I think the term barrier reduction or removal has probably varied over the last 20 years. What do you think it currently means?
Well, so it depends, right? So for some individuals, it could be reliable transportation. And so I'm going to talk about that a little bit later. Others is access to childcare. Sometimes it's just the money to pay for credentialing, or in other instances, it's access to mental health services or substance use services or domestic violence support. So some of those things, and how do we connect people to those so that they're successful at work?
Thank you.
Yep. So the Bureau of Family Assistance primarily is the focus is to gain access to supplemental nutrition programs, which we call SNAP, medical coverage, some of our state supplemental programs, which we'll talk about, the TANF program, and child care scholarship. With really the focus to ensure that adults, children, and families have access to health care, nutritious food, child care, and financial resources. BFA also sets policy and program implementation for the SNAP program and for the TANF program. The Bureau of Employment Supports, which we just referenced, is really, it's the work program for individuals who have TANF and SNAP. Utilizing a whole family's approach to jobs framework, NHEP works to provide parents with the employability skills that will result in establishing careers and ultimately will help move children and families out of poverty. Some of the work they do is to ensure participants gain employment, have an understanding of community resources, obtain certain life skills to balance work and family, and then really focus on an identified career pathway. We'll work with laborers and educational training organizations to address labor market needs through training. We focus on training opportunities to assist parents in gaining employment credentials. So, for example, recently within our division, the Bureau of Child Development met with the Bureau of Employment Supports and said, okay, how do we provide resources so that individuals who are on TANF or SNAP will go into the child care field? How can we take some of the resources that we have for education and help generate more workers in the child care industry? In a couple of weeks, we're actually meeting with a nonprofit organization that's really looking at their workforce and workflow. And the Bureau of Employment Supports, along with the Department of Employment Services, we're both meeting with the agency to say, all right, how do we frame our services so that we can provide you with some resources for employees. Here we will, these are the caseloads we have for the different programs under the Bureau of Family Assistance. And you'll see we have here for the different fiscal years. The first one is TANF, which is the cash assistance. And so on one side, you see the caseload numbers, and on the other side, you're going to see the average monthly grant. The families with dependent children, I think that's the right, I always mess up that acronym, that is tied to TANF. It is a relatively small number. We have the interim disabled parent program, which again is tied to our TANF. The old age assistance, aid to the, and I should back up, the FWOC and IDP, that goes towards our TANF MOE. And then we have old age assistance, aid to the needy blind, and aid to the permanently and totally disabled, which goes to our Medicaid maintenance of effort. And these are the numbers of individuals in these categories and the monthly average grant that individuals receive while on this program. Any questions? Okay. And then here is the actual monthly grant for fiscal years 18, 19, 20, and what we've have budgeted for 2021.
Hold that there for just a second.
Yep, that's fine. I'm gonna grab my other sheet of paper too. Hold on a second. Okay.
Thank you. You can go.
I can't hear you, I'm sorry.
Oh, you can go.
Mm.
Okay.
Okay, sorry. And here's where we are with what we budgeted in fiscal year 20 and our actual expenditures in fiscal year 20. You'll see that APTD, we actually spent more than we budgeted, and TANF was down a little bit. So there's fluctuations within these caseload types. Can I go ahead or?
Yeah, just
Okay.
go unless
Okay.
I interrupt you.
Until you say something. Okay. And here's where we are budgeted.
Okay.
Oops,
Oh, there we go. Representative
Okay.
Wallner has a question.
Sure.
Chris, at some point, could we get a report about how much is in the TANF reserve fund?
Mary, do you, or Karen, do you want to report on the TANF balance?
Sure. The TANF balance is currently around $40 million. We expect it'll be a little bit lower than that by the end of the fiscal year, but that's where it currently is. It is quite a bit higher than we estimated it was going to be this biennium. When we talked about it last biennium, we were coming close to, we estimated that at the end of this biennium, it would be around $14 or $15 million. Two things that have affected that the most. One is caseloads being lower than anticipated, and Chris could speak to why caseloads might be lower than we anticipated. And second being that we did not use TANF. TANF was not needed in the childcare budget, which I think was budgeted several $1 million a year. So that increased the TANF balance as well.
And we also, Karen, reduced the contracts that we were paying out of TANF and as a whole in the department. And we really focused on, you know, those that met the 4 goals of TANF to really streamline which contracts we use that funding for.
And Chris, can you speak to the TANF caseloads being lower than anticipated?
Yeah, so this is actually, it's actually interesting because I've been working on this. Our numbers are lower. And what was kind of fascinating to me is last night I was starting to get emails from the other New England states. And we do a lot of that, right? Like, what do your numbers look like? And they all have lower TANF numbers. And everybody's trying to figure this out because we have, you know, an economic crisis with COVID, you know, so what's going on? So there's a couple of things that are happening. The first piece is that with TANF, you have to be working to access TANF. There are certain work requirements. And so while unemployment is up, people are actually getting more money with unemployment and the federal unemployment so that they're not necessarily needing the TANF money. Also, we've been providing a ton of resources through our SNAP program, federal resources for pandemic EBT, which provides cash assistance, SNAP dollars for families who have kids who are getting free and reduced lunch or are eligible for. We've been providing the maximum allotment for SNAP benefits, which is a federal program. We also have people who have been receiving the economic stimulus payments. So a number of people either aren't applying for TANF right now. We actually had some bumps where people applied when unemployment went down, when there was a gap, but we have not seen increases. We do feel and we believe that once the additional unemployment goes away, once the SNAP benefits go back to pre-pandemic, there's going to be an increase of people applying for TANF. It's just something that we're kind of waiting for that to happen, and we've been waiting for it actually throughout the pandemic. But at this point, it doesn't seem that people are applying because they're not needing the resources right this minute. That doesn't mean that in 3 weeks, 4 weeks, a month, people are going to need those resources.
You have a follow-up? Representative Weiler?
Mr. Chair, FWOC, families with older children. How old, what are the age limits, and how do they qualify?
So Mary Calise, can you jump in? Because I mess this one up all the time. Or Deb Sorley.
Yeah, let me bring Mary over.
Thank. It would be
Representative Wallner, your hand is still up. Are you going to have a follow-up, or is that just a?
Good afternoon. I'm sorry, could you repeat the question?
Yes. Families with older children qualify for some programs. What are the ages to be older children? What's the range of ages, and how do they qualify if they have older children?
They have to be in high school. And I believe it's up to age 19, but it may be 20. But they do have to be in high school.
And so why do they get help?
I would have to go back and research that, Representative.
Yeah. Obviously, there isn't anywhere near the numbers of program, so it seems specialized for some reason. Anyway, thank you.
We can go back and get the history for you. I believe it was a way to help families transition slowly off of TANF while they still had children in high school. But we can go back and get the actual when the program was established. It is a relatively small number.
Normally, if you're a family getting assistance and the only child you have possibly achieves the age of 18, which is supposedly a legal age, so that would not be counted then other than this program. In other words, you're no longer a children.
Right. This just, but the child,
unless they're still in high school and you still have needs.
Right. So they have to still be in high school.
Okay.
That's the piece. It's really the high school component which allows the eligibility in this program.
Thank you.
You're welcome. Can I go?
Well, no, we have a couple questions.
Okay.
This is a great slide. We got everyone going now.
Good. Uh-oh. Well, then don't turn Mary Calise off then, because she has the wealth of information.
Representative Nordgren? You're on mute.
Sorry. Is this one of the programs we raised the age last time? I think there were some programs that were 16, and I think we raised the age. Is this one of them?
In the last budget?
Yeah.
No, not in these. We haven't raised the age in these that I'm aware of.
Okay, must have been another program. Thank you.
Yeah, you're welcome.
The DCYF program, we raised the age for, the legislature raised the age for foster care.
Okay, thank
That might
you.
be what you're thinking of.
Representative Erf?
Yes, thank you. It looks like in your caseloads FY21, December 2020 actual, your total column is a copy of your PIT caseload column.
On the previous slide?
On the
It
one
does look like there's
that's on
an error
screen right
there
now.
on the TANF row.
Well, no, the column, under the total column, under the blue.
Yeah. I'll have to fix that. Thank you.
Yep.
Oh, I see. Okay.
But it's consistent.
Mm-hmm. Yep.
All right, are there any other questions? All right, so you're free to continue.
I'm free to click. Okay. Whoops. All right. And here just is our SNAP caseload. This doesn't, we get lots of questions about this. And so I just wanted to put that in here. The SNAP, we had an increase in expenses because we created a lot of SNAP benefit programs, emergency allotment, pandemic, EBT, plus there was a 15% increase in benefits. So I just wanted to show you the average caseload. We still are not seeing a huge increase in SNAP due to the pandemic. Early on in the pandemic, the additional $600 was counted towards SNAP, and now the additional unemployment is not counted in SNAP. But I just wanted to include this in the slide deck.
So.
Yep.
You mind if I ask a question?
Nope.
Go ahead.
So the costs shot up, and I understand what you just said. Were those funds COVID funds?
So Rebecca, these were all COVID related for the emergency allotment, pandemic EBT, and the increase in our benefits. Yes, it does not impact us.
So just kind of a general question. How would we see how the COVID funds were accounted for? Do they not appear in anything we're looking at here, either historically or going forward?
Rebecca and Karen? You're going to see the COVID in here, I believe, in 21.
So
I
most of
believe it's just, go ahead, Karen, sorry.
I was just going to say, most of our COVID funding we put into separate accounting units. And so because we're not continuing to budget those would not show up in the budget.
So can you just get us an accounting of the $1.2 billion, roughly?
So if you're talking about the 1.2 that Gopher received, Gopher would need to provide that for you. I can provide for you what the department received.
Okay. That's what I'd like to see.
Okay.
This here, the fiscal year, I believe the 20 and 21 are the COVID related funds for SNAP benefits.
I mean generally across the whole.
Yep.
HHS.
Chris, could I please add that we
Yes.
don't budget the SNAP grant dollars at all, that we have administrative oversight of the letter of credit, but that we do not include the dollars paid for food stamp benefits in our budget. The vendors square up with the contract provider, and the contract provider squares up with the federal government, and we monitor that activity.
Thank you.
Okay. Can I go? Is it okay to go to the next slide?
Could I just,
Sure.
Oh, go ahead.
So Representative Irv, I was going to say, you can look at how the Gopher funds, how all those funds that $1.25 billion was spent by going to the Gopher website. And also the LBA has been tracking them, and they might be able to provide us with a reporting of the how those funds all went and were used in the state.
Thank you.
I can send out a link on our website. We update weekly a spreadsheet of all federal COVID funding. It's not specific to the department, it's statewide. And it may not be down to the level of detail that you're looking for, but I think you may find it helpful.
Can I go to the next slide? Okay, thank you. And this here is just the numbers of people served in the New Hampshire Employment Program. And there's a direct correlation because this program focuses on individuals receiving TANF. So a decrease in TANF numbers would result in a decrease in New Hampshire Employment Program. And so that's why there's been a decrease during 20 and into 21.
And I would just add that the increase that you see from 17 to 18, if you remember when we presented the department-wide presentation, there was a change in TANF eligibility and who is eligible from 17 to 18 during that legislative session. So that's why the numbers increased there.
Thank you, Karen.
Do you remember generally what the nature of the changed eligibility was?
We could get that for you. It was in legislation. I don't remember the exact amount of the change.
Do any of the legislators remember what the changed eligibility was?
How long ago?
It would have been during the 2017 session because it became effective in 18.
There was one where we changed if there were two parents in a household. It was treated differently than if it was single.
This was actually an increase of the TANF grant, and I don't have the exact percentage that we went up. I don't know if Mary Calise has it, but I might have it on a piece of paper, or Rebecca might know. But I can get that for you.
Yeah, we can get that for him. Mary's on another call right now.
Okay.
But we
I
can
can
get
find
that
it for you. I can get that as well. It was House Bill 2 from 2017, I think.
Okay, that'd be great, Kevin. Thank you. Because it changed the amount of the TANF grant, but it also changed the FFP percentage. So it changed the number of people eligible as well as the amount they received.
Yep.
Yes.
Great.
Thank you. Okay. All right. So just a little bit about BFA. These are the programs. It really is eligibility, access, and determination for these programs here. That is primarily on top of the policy work that BFA does. And then when we move to the Bureau of Employment Supports, they provide TANF recipients are required to participate in a work program. So in order to continue to receive assistance for TANF, you need to participate in a work program. And so here's some of the resources that we provide in addition to connecting people with other work programs within the state. So career guidance, these are some of the barrier reduction services that we will be providing. And we also partner with businesses such as like CVS around getting people into career pathways and working on some of those barrier reduction services. And then we also have a program for individuals who are on SNAP, which is the food stamps, and that's a voluntary program. And that's really helping people obtain jobs such as job search materials, resumes, assistance with transportation to help people access employment who are on SNAP.
So if if refugees get EBT cards, is that under this or is it somewhere else?
If a refugee receives an EBT card, they're either getting SNAP benefits or TANF financial assistance. Was that the question?
Yes.
Okay.
I was just curious if there was
Okay.
another, because earlier in all of these briefings, we covered a refugee budget line. And I just was curious where the EBTs would be budgeted.
Yeah.
It sounds like in TANF or SNAP and not back in
We-
the other account.
I'm going to double check on that because I do know we have a couple of small programs that are targeted. And that may be one of them. And I actually think I'm thinking out loud, which is always dangerous for me, that there's actually some pass-through money that comes through into BFA to provide supports for individuals on that with the refugee cash assistance.
So the related background question around that is, are we properly anticipating the increase in refugee population that's expected in the next couple of years? But
So I will have to get back with you on that. I don't have the answer to that, but I can get that information. Okay. All right, I'm gonna, service delivery. We provide services through our district offices. And so we have staff in all of the 11 district offices. We also have some centralized units here in Concord. All services through BFA are done through state of New Hampshire employees. In addition to coming into a district office, we do phone interviews, we do phone appointments, and we also have New Hampshire Easy, which allows people to apply and access their benefits online and manage some of their services. The Bureau of Employment supports are also provided statewide, and it's a combination of our own state employees in the district offices and also some contract services through Southern New Hampshire Services. But we have statewide access. Some of the accomplishments over this last year is, to be honest with you, within this program area, we transitioned to working fully remote without any disruption to individuals receiving services. When the pandemic first hit, we started to reduce foot traffic in the district offices because there's a lot of people that come in and out of the district offices. And so we reduced the number of people coming in, and then we transitioned to remote. And people are still able to apply, and we received a number of waivers from our federal partners to allow us to do appointments by phone. We do receive faxes, email, online, everything we were able to do remotely. And so we have continued to do interview appointments on the phone, and then face-to-face if requested and if needed. And then one of the benefits of this actually is individuals have increased their use of New Hampshire Easy, which is much easier for people to upload their information and access their benefits.
Representative Irk has a question. Are
Okay.
you at a good break spot?
Sure.
Do you see that continuing post-COVID if we ever get there? The remote, working remote?
So it's funny, because I can remember meeting with staff like 2 months before the pandemic, right? And so saying, oh, we would love the ability to just work at home once in a while. And we kind of laughed. I'm like, I'm with it, but it's probably going to take us a couple years to get there. And then 3 weeks, we were able to roll it out. We're never going to be in this area 100% remote, but I do think we will be able to look at some hybrid models, because there is value with people being together in the office, but yet there's also value with people being able to do certain aspects of their job remotely. And we've worked through all the kinks of how, the systems work, because they're pretty complicated, but we're always going to have people have the ability to come into district offices and meet one-on-one with people, because that's really essential. But I think we'll have some type of mix when we're out of this.
Might that allow for space reduction?
That is something we actually have talked about, and we've talked about with facilities that, we might not need as much bricks and mortar and have maybe more shared space. That is something we're looking at.
So are you looking at it hard enough to where we can reduce the rents budget for the next 2 years?
Probably not. And that's not something that, that's something we'd be doing in conjunction with facilities. And
Kevin, can you bring over Lori Weaver? She could definitely speak to that.
Is she out there or is she just?
is.
Oh, wow. Must be a slow day.
I doubt that. She's probably doing multiple things at once, if I had to guess.
A box of rocks.
Lori, are you there?
She should be there now. She's a panelist, I'll put it that way.
Okay, it's very possible that she stepped away from her desk and kept us up while she was doing something else. So maybe we can come back to her when she becomes available.
Okay.
yeah. So another accomplishment is we have increased access to nutritious food by the SNAP Pandemic EBT, and that was in collaboration with Department of Education. And we're actually at the point of getting ready to submit another pandemic EBT plan to Food and Nutrition Services. We actually began participating in the online purchasing program in July, which was a response to the COVID-19 pandemic when people didn't want to go out to stores. But I definitely think this is something we're going to continue because there's a lot of people who receive SNAP benefits who may not have transportation, may be elderly, maybe have young children. So that's definitely been a positive benefit that we want to continue. We've actually, another accomplishment is, I mentioned, I think earlier, we have assisted people in our New Hampshire employment program receive their high school diploma or equivalency this year. So that was a real big benefit, 128 people. And finally, we continue to enhance our collaboration with other statewide work programs. And so really working on what are the other programs that people can access so that we can ensure people have access to jobs. Okay, can I go to the next slide?
Yes.
Okay.
Yes, you may.
Okay, thank you. Some of our key challenges are just the continued need for technology to support the work of our employees and enhance our customer service. I think that's really where we need to continue to spend time and energy on that. Staff vacancies and turnover are larger in this area of our division, and I will get you those vacancy numbers, but because these are entry-level positions, so lots of people will come in and use this as a stepping stone, which is great for other parts of the department, but it kind of causes some vacancies in this area. A challenge is always to focus on staff training. I think we really need to focus on enhancing our training and how it's being provided. Again, one of the things we learned about with COVID is, how to do things on Zoom, right? I don't think many of you thought 2 years ago we'd be doing Division 3 finance on Zoom. And so how do we continue some of that training for our staff so that people don't have to drive to get access to training? And then finally, we talked about this earlier with our division overview, is the cliff effect. I mean, that is a challenge, is what policies do we look to change so that people are encouraged to work, be successful, but don't end up being worse off for their family and essential services. So that is a challenge that we're working through. And I look forward to continuing our work in this because that will be critical. Anything else?
Any questions?
Great. So now I'm going to go to your favorite slide.
Yes.
So we actually have some benchmarks. So for our food stamp, there's actually national standards that say you have to be at 6% is the lowest you can, that's like where you have to be below that for errors. And so we are currently at 4.92%. So that is really a good, we are actually ranked 5th in the nation for our payment accuracy.
So can I just point out on this slide that the first two circles there,
Yeah.
What's listed in workload feels more like a quality standard.
Okay.
If you look at the third one, you have a workload standard in the third one, but not the first two.
Okay.
But no, it's great.
Yeah, and I mean, I think part of that is tied to our workload, and so I can actually get what our caseloads are, but that helps us remain in that quality standard. And the same with application processing. You know, technically, we are supposed to have 90% of our applications received have to be processed within 30 to 45 days. We're currently at 92%. And much of that is beyond our control, but yet we still have to be tracked. If somebody cancels an appointment, if somebody doesn't show up, their application doesn't get put in a different pile. And so that's something that we have to continue to work at. And then
that's a quality standard, though,
yep.
Right?
But I can get you the actual workload numbers we have here.
Yeah, and by workload, just in case it's not clear, I mean, what are the drivers of your FTEs?
Yep.
Like
Yeah, it's the application processing, so I can tie that to that definitely. And then you'll see for employment supports, we have about 50 to 60 participants for caseloads. And then one of the standards is that we have 50% of our participants have to attend to their required hours weekly. So in order to participate in TANF and New Hampshire employment supports, you actually have to be working or engaged in training for 20 to 30 hours a week. Whoops, I am.
Nope, we're good. No questions.
Okay. Here is our budgets that we're going to review in our when we go through the budget slides. And so you'll see the majority of our funds are federal and general funds. And Rebecca, correct me if I'm wrong, some of the other funds used go towards our MOEs for Medicaid and TANF.
The other funds?
Yes.
Is that
no? Sorry.
The other funds, or
yes.
are you?
Yeah, the other funds. What are those?
Those are. There's the sorry, I have that. It's in the TANF budget.
Okay.
It comes from I know there are other funds that we collect.
Okay.
And use. I can look into that a little bit more.
Okay, we'll get you that information.
So we can use this slide to look at the right two bubbles. And the total funds look to be about the same, but the percentage of state funds to federal funds shifts dramatically. So what's the underlying story on a huge drop in federal funds and a huge increase in general funds? Do you follow my question?
Yeah, I see it. I'm channeling Rebecca on this one.
In oh, Go ahead.
Go ahead. No, please go ahead, Rebecca.
There's, it looks like we used less in 20 than we had, probably due to the COVID, because we were using more federal dollars than the general fund.
It actually looks like, Rebecca, that the general funds in 2021 might be only 1 year, where the 22-23 is 2 years.
Ooh.
Just like taking a quick look at the budget.
Okay.
So I think the middle chart is incorrect and should actually be about double that, Mr. Chair. And the reason that that would be such an increase from 18-19 to 2021, those that were on the committee last year remember that, and I've talked about it a little bit when we did the department-wide presentation, that we budgeted in such a way that now we can actually tell you where every TANF budget dollar is budgeted. Well, the secondary piece to that is we now know where every dollar of MOE is budgeted, which is about 34 million. I always forget the exact number, and Mary usually sends me a text and tells me I said the wrong number. So I know it's in the low 30s. And so because of that new way we budgeted, and this is where I usually check the attendees, although it's recorded, so it doesn't matter. It's when we realized that we may not be budgeting all of the MOE that we should have been, and that we might have a federal audit problem because we were not budgeting all the MOE. So,
we are recorded.
Yeah, I know, and it's okay. I think we're past those audit years for 18, 19. I think we're okay, because 2021, we actually budgeted those dollars and actually made sure to spend those general funds to meet that MOE. And so that was the increase that happened from 18-19 to 2021. And like I said, that 46 million should actually probably be about double that.
Yeah.
That was just missing part of the general funds.
But yeah.
Okay, so then let's look at the left and the right bubble. In the federal funds, we went from 118 to 108. So we are letting air out of that bubble. So what's going on there? Is the federal government cutting back their percentage, or is that another kind of accounting thing?
No, that would be because we're budgeting the TANF based on, or I think we'll see it when we get into the accounting units, but my assumption is because we are budgeting the TANF based on current caseloads, which, as the director mentioned, have been lower this year than have been budgeted in the past. So that would, the amount of general funds we have to spend does not change. That low $30 million number, we have to spend that whether we spend $1 in TANF or spend 60 million in TANF. So those general funds will always be budgeted, and then the amount of federal will becomes the variable amount depending on caseloads.
You can keep going.
Okay, thank you. So again, here's our 5% up and down. With additionals, we would actually increase the number of field staff so that we can have work meet some of our timelines and workload balances. We would increase our training unit staff and dollars in staff development. We would enhance the customer service platform so more people can do more online.
We hold up a second there.
Yep.
Okay, so the training unit staff, I thought, and this is from 2 terms ago, I thought that there was a department in the New Hampshire state government that basically owned training, that they were the training organization for all state departments. This sounds like you're talking about growing your training unit organically within your division.
So we actually, within the Bureau of Family Assistance, and this training is specific to the eligibility programs that we have. So this is on eligibility programs. So this is within our Bureau of Family Assistance, and it's focused on, we have staff need to know over like 40 programs. So it's how do you figure out what somebody's eligible for in Medicaid, in SNAP, for childcare. So it's specific to training to do their job. So
Something that somebody in DOIT or DOT doesn't need to know.
correct.
Subject
It's
to-
very specific to how do you process a case for eligibility.
Okay.
And so a decrease would be impact on staff positions, loss of opportunity for technology enhancements. We would slow the timeline for adapting program services to meet new employer needs, and staff development won't be enhanced to meet staff needs. So those are some of the up and down that we would have.
Same general comment, if these could be made measurable. I mean,
Yep.
these are nice general terms, but
Okay.
thank you.
Thank you. And then here's the different accounting units within the budget briefing book and the budget book, which we're going to go over now, I believe, with Karen and Rebecca.
Yes. Do you want to cover your staffing slide at all?
Oh, sure. So just here is our staffing. We have a number of different staff within BFA. So there's 14, and director's office is an old term. It's really more of the policy end of the Bureau of Family Assistance. We have 32 people working in the Bureau of Employment Supports as employment counselors. We have 370 employees out in the district offices doing field operations. That's the eligibility workers. One person under community service block grant. We have 22 people in New Heights, and we have 16 people in our disability determination unit. So that is our staffing. So it's a pretty big bureau. So I'm going to stop my screen sharing and enable Karen to do hers.
Great. Thank you, Chris.
Thank you.
Representative Wallner has a question before.
So Chris, it was just on your slide with all the employees. I think we saw that. We talked about that before, but so most of those employees actually were considered to be frontline workers, so that you did not have to have the hiring freeze with most of them, right?
Right. So for the employment support, those 32, those were direct service. The 370 were direct service. So the rest of the 16 for the disability determination unit, those were all direct service.
I have one further question for her, if that's all right. Of the 370 and the 16, the direct service ones, were you able to figure out what the vacancy rate is, or how many?
Yeah, I didn't. I will go back and get that for you right after, if that's okay.
Okay.
I will provide that to the committee.
And I just one more about that.
Yep.
So worker caseload. Well, how many cases is one of your eligibility workers carrying? And is it within sort of a national standard?
So the hard thing is I don't have the caseload handy. And so I will provide that with you following. But the hard thing is, because I've looked at this, Representative Wallner, 100 times from front to back. And because we do integrated eligibility, it's very hard to find a national standard because most states do not have eligibility as integrated as we do. And so for instance, when we were working with the consultants, they paired us with a couple other states, and they did everything except for, SNAP and TANF were done differently. So it's very hard to compare us to other states, but I will get you that information.
Great. Thank you, Chris.
So the overall vacancy rate for this bureau is 12%.
Okay.
And
Thank you,
again,
Karen.
when you say you're going to get Representative Wallner the
Yes.
information, you're saying you're going to get it to Mr. Ripple and he's going to make sure the committee gets it.
Correct.
Yes, I will. Thank you.
Even if it was for one representative, I always provide it to Kevin, so he generally distributes it to the whole committee anyway.
All right. I won't bore you with that statement again.
Okay. So we are starting at accounting unit 6125, which is located on page 973. And here is accounting unit 6125.
So the director's office looks like it's going up 4.9%. And it's adding 2 unclassified positions. Is that right?
Yes, those were previously budgeted in a different accounting unit, so they're being moved. They came from 7996, which is in their same budget overall. It's just a different accounting unit.
And I did provide Kevin the list of all of the positions that have been moved in the department.
So those 2 coming over, is that really the baseline for why anything else might be shifting, like benefits?
Yes.
All right. I don't see any questions here.
Okay. The next one is 6127, which is employment supports.
So this was the one that's the big drop in federal money and a big jump in state money. And
Yes,
it may be,
the overall budget is reduced though. So that would, see here, the 9.75 is what was budgeted, and it's being reduced to 6.1. So this goes back to what Chris was talking about earlier about ensuring that we're using the funds for their most core purposes.
If I might add, the other funds in this accounting unit for fiscal year 21, that was for, was it Granite Workforce? And that didn't pass, so we did reduce the budget.
Yes, the work program for Granite Workforce was in this accounting unit.
Yes, so that would.
so you're saying in 21, it went from 1.3 million to just 11,000?
Correct.
Where's the 11,000 coming from if Granite Workforce wasn't passed? Wouldn't that be 0?
What line are you all looking at?
Rebecca's looking it up right now.
Yes, Representative Burr, why don't you ask your question in parallel?
Okay, part of it relates to what you, okay. Expense number 049, I'm just curious what that is, the transfer to other state agencies?
Karen, isn't that New Hampshire Employment Security?
I was thinking that's what it is, but
We
I'll
need
let
Rebecca to
Rebecca
confirm.
that, but I believe that's what it is.
Yeah, that's fine. And what line were you looking at, Jess? What expense line? What number?
You're on that 049 transfer to other state agencies. That looks like it's going up about 13% between the budgets on an annual basis. That's a pretty big jump. What's changing?
I'll get that information for you. I don't know it off the top of my head.
But where were you looking with the 1.3 million to 11,000? What line was that on, Jess?
Oh, what started this was my looking at just the general funds versus the federal funds from budget to budget, where in the current budget, state funds is about 29% of the total, and in next budget it's going to be 43%.
You're talking about total funds, but there was you threw out numbers 1.3 million to 11,000. Where was that?
Oh, that was in here.
It's on page
Transferred to other agencies.
975.
That's your transfers?
That's here. It's the,
Yeah.
if you look here on the screen where it shows the different types of revenues, the 1.3 was here in fiscal year 21 and is now 11,000.
Okay.
So we'll follow up with both of those questions,
Yeah.
what this 11,000 is, as well as the transfers to other state agencies and why that's increasing.
Thanks.
And I'm sorry, which line is it that you were talking about, the other state agencies?
The transfer to other state agencies, do you happen to know where that's going and why it increased?
001.
Well, I think the question, Ms. Rounds, is more like if the Granite Workforce Program went away, then what is this 11,000? If there's no program there, it should be zero.
Yes, that's one question. I thought the second question was, why did the transfer to other state agencies go up?
Correct.
Yes.
Yes.
On line expense
Is
0.
that class 49?
Yes.
Okay, 49.
So we can get those later.
Okay. We will get both of those answers for you.
So those are our payments that are paid to New Hampshire Employment Securities. We get the
why?
budget from them. They provide us with the numbers. So
What
we
are they
align our
providing for
budget with
services?
theirs.
What are they providing for services, Chris?
Oh, it's online access, cross match.
Yeah, there's a bunch of things that we have a number of MOUs. I can get a summary of that, so I don't misspeak. It's related to working and accessing benefits and all of that stuff and unemployment.
So I'm sure this isn't happening, but I could imagine a really creative accounting where one department in Division 1 charges a department in Division 3 much more money so that there's more money in the state system as a result of it, because I don't have time to go coordinate with Division 1 to find out what's going on. So
I can assure you that I would not pay an agency more than they need to provide the services to us. I would throw a stink about that because that affects my budget and affects my ability to operate the entire budget. So I would absolutely not allow that to happen.
I believe that.
Thank you for that. And I'm sorry I exposed one of my cynical sides to you.
It's okay. We all have fun about different things. So
Yeah.
totally understandable.
All right. Do you want to continue on to the next budget area?
Sure. So the next accounting unit is 6146, which is TANF, the Temporary Assistance to Needy Families. What I would mention is we did have a prioritized need for fiscal year 22 only for $600,000. We're about $600,000 under the required MOE. So you will see that on the spreadsheet of all of the prioritized needs, which I should have to you early next week.
Okay, I appreciate you saying that. While I'm making notes in the Excel sheet, could you tell me what funding line or what expense line you're going to want the money in?
So I believe that would go in class line 501.
Correct.
Payments to clients.
Yes.
So the note there is you think this is 600,000 low?
Yes. Well, the general fund piece is, so it would reduce the federal funds by 600,000 and increase the general funds.
Oh. So it's,
So the actual expenditure would not change, that just the fund mix would change down here.
why can't we do it the other way and get more federal money?
We definitely draw down every federal dollar we can, but we do have to spend the entire MOE.
MJ has a question.
Don't tell me MOE again. What's that?
Maintenance of
Memorandum of,
effort.
okay.
Maintenance of effort.
All right. So Representative Wallner has her hand up.
Karen,
Yes.
so can you talk for a minute? I don't know, maybe you have already gone over this with the division, but can you talk a little bit about maintenance of effort and what it means? I mean, what do we put at risk if we don't meet our maintenance of effort?
Sure. So it's a common misunderstanding that match and MOE are the same thing.
Yeah.
They are slightly different, and it's something that I, quite frankly, didn't understand when I first started with the department either. And Mary had to spend a lot of time with me saying, you cannot use those words interchangeably. They're two very different things. So match is a percentage that if you spend a federal dollar, you have to spend a general fund dollar. Sometimes it's 50-50, so it's $1 to $1. Sometimes it's 25-75 or 90-10, or lots of other various percentages. So that is a match. An MOE is that you have to spend that much in general funds, regardless of how many federal dollars you spend. So there is a slight difference there. There can also be changes to the MOE. For example, under the CARES Act, to receive the enhanced FMAP and Medicaid, part of the required maintenance of effort is to not take anyone off of Medicaid. So that's not really a general fund that must be spent kind of MOE. It's actually an activity that we have to do for MOE. And as we get down into some of the other programs like APTD, that's similar. It's not that the federal government says you have to spend, $10 million on APTD. They say you have to have this program. And so whatever it costs to run that program is what it costs to run the program. So that's where MOE and match are a little bit different.
And
A really great explanation. So it's like MOE is the fixed cost where you got to get into the program, and then the match is really sort of like the variable cost to get additional federal money.
Yes, the match is directly tied to how many federal dollars you spend, but the MOE can vary based on whether it's an MOE to run a program or an MOE of a fixed amount of dollars you must spend.
Sometimes we get a good deal out of it. I remember in Division 2, school lunches. When we first started with school lunches, it was like a one-on-one match. And then it became a maintenance of effort. And by the time 20 years went by, the maintenance of effort was exactly the same, but the federal funds were about 10 times more. So sometimes the maintenance of effort is, just you got to make some little effort, but they're giving you more money every year. But the maintenance of effort sometimes is a historical thing. It doesn't change every year, whereas match likely does.
Yes.
All right.
I wish I had more programs that happened where the MOE stayed the same for lots and lots and lots of years. That is true of TANF. That has been the same MOE for many, many years, but that is also a very high MOE.
So Representative Wallner, your hand's up. Is that a follow-up or just an artifact?
It's a follow-up, actually.
Right.
Karen, I was just going to say that we have had this maintenance of effort for a number of years, and it was a formula set many, many years ago. Do you remember what that formula was?
I do not. I was just looking to see if Mary is still a panelist. It looks like she's not in her other meeting anymore.
I bet Mary remembers.
Yeah, because I think I think it's from when TANF started. It's with the same formula and the same MOE.
Yes.
And
We did
I-
have one penalty though in like, I'm not gonna get the year right. It was the 80s or 90s. There was a small penalty that ended up increasing our MOE. I don't see that Mary's typing to me, so she,
If I could, I don't know the formula, but I think the MOE and the federal grant were both put in place in the 1996 federal welfare reform bill, and I think they've been the same ever since.
okay.
Yeah.
Good.
And
Thank you.
I would add, there's been many times where reform has been added to current bills at the federal level, and so far no changes have been made to it, but it's something I know Chris monitors, I monitor, Mary monitors, because changes to the program would affect us.
Yeah, we keep on preparing for TANF reauth, and it keeps on getting extended and extended. So.
Thank you.
All right. Okay. I'm gonna come down to 6153. Which is on the bottom of page 976 and the beginning of 977. As Chris mentioned earlier in her presentation, this accounting unit is MOE to TANF. So any reduction here in general funds would mean we would just have to increase general funds somewhere else to continue to meet the MOE. The same is also true, Chris, of 6170. Is that TANF MOE?
That's Medicaid MOE, if that's old age assistance.
Okay. Not hearing any questions, so I'm just going to continue down to 6171. Aid to the needy and blind grants.
Is that also some kind of MOE?
Yes.
Yes. All of the general funds in these programs here are related to MOE, right, Karen?
Yes, either
For
Medicaid or
Medicaid
TANF.
or TANF, yep.
Yes.
I'm learning.
The next one, 6172, does refer back to a question that came up earlier about budgeting for the refugee grants. Here, we've budgeted based on what we've experienced in 2020, not any potential anticipated increase.
That must feel like the right way to go for you. I understand that the new administration anticipates opening up the refugee pipeline a little bit more.
And it does look like the source of funds is a transfer from another agency, so I'm not sure if there would potentially be additional funds that could be transferred for if this ends up higher.
In the first year or two, the feds send 100% of what our refugee cost is supposed to be. Is that true?
I don't know the answer to that question.
And I believe this area is specific for the benefits that are under Bureau of Family Assistance, but we can get all that information for you in a follow-up for the committee.
So my main thought on that is just to double check your budgeting assumption about changes in refugee volumes. And I don't think I need any information back. I just would like you to just double check that you think you're budgeting properly. And if you got a different number for us after thinking it through again, just come back.
Okay. All right, we will do that. And to the earlier question about how does this budget relate to the Office of Health Equity that you heard about earlier, these are actually transferred from the Office of Health Equity. So these are transferred within the department.
Which line was that?
Will the Office of Health Equity.
OOC,
It's within the OCOM budget. I don't remember the accounting units off the top of my head.
That we're looking at right now, one is the 6172 OOD, that's what you're talking about?
Yes, yeah, that these are coming over from an OCOM budget. So we will take a look at that and we'll submit a change request if we think there's any need to. Okay, and then we come down to APTD grants. You will notice that fiscal year 20 here is higher than fiscal year 21. This budget, the APTD budget, was reduced in the House phase from the agency and governor budgets for 20 and 21. They were reduced based on caseload assumptions that the House had done, and they were the caseloads we experienced did not drop as much as the House had anticipated. So we are budgeting those where we believe those caseloads will be. This, we did have to do transfers of general funds into this class line, and I anticipate we will have to do the same in fiscal year 21, probably about $1 million, $1.5 million. So we are budgeting a slight reduction from 20 in 22 and 23. Again, these are areas, as Chris spoke to, that as the unemployment benefits change, if the economy continues to be down, that we will start to see increases in this budget. And I'm getting a message from Rebecca that we already moved 1.3 million in fiscal year 21 at the last, or in one of the past few fiscal meetings, probably in the department-wide transfer. All right. 6176 is state assistance non-TANF.
Hold on just one second.
Yep.
So that line you're just talking about, Karen, that's also MOE money, is that correct?
Yes, this is MOE to Medicaid.
So you have to spend it. I mean, you have
Correct. We have to operate this program under Medicaid. So if it's under budgeted, we have to transfer funds. We cannot say, oh, we're shutting off the program, we're out of money.
Right.
We have to operate it to receive the match in Medicaid.
This is direct cash assistance to individuals that have disabilities. So.
$61.76, which is at the top of page 980.
you have a question, Keith? You look like you raised your hand a moment.
Sorry, I had my mute on. Yeah, I don't have a question. Sorry.
Okay.
Sorry.
The next one is 7148, which is Community Services Block Grant. We call that CSBG for short.
Did we go over that in the slide deck? What is that?
Yep, that is money that goes to the CAP agencies. That was in the the division overview, and that's 100% pass-through money from the federal government. It's to go, and it's in legislation. It goes to the CAP agencies to do poverty reduction.
There is a small amount of general funds there as well.
Sorry.
$7,000. Which is most likely related to the employee and their cost allocation.
Good, thank you. One employee.
The accounting unit at the bottom of this page is 8025, which was workman's comp. That, as I mentioned, we've moved to the OCOM budget. This is one of those areas that I mentioned had a smaller budget and that we consolidated department-wide. 7215 is SSBG.
so, I have no question.
Rebecca, what was the change in SSBG that general funds are now required here?
The nature of this program looks to have shifted too, right? If you're going from contracts to grants.
That's actually, the change from contracts to grants was what I spoke about earlier, that to better track the subrecipient contracts, we've moved those to class 74. So it doesn't necessarily mean that the program's changed. We're just trying to track it better.
So this SSBG came from DCYF, and there was another piece that we used to fund the contracts for the community or comprehensive family support services. And the general fund piece came from a different accounting unit within BFA. So we just kind of put them all in one spot.
So they're not new general funds. They're just moved from.
No. Right.
I don't see any questions.
Okay. 7216 is the kinship grant, 100% federal. This again has that change from 102 to 74 for us to better track. It's really about the single audit, the audit that's done by KPMG. This helps us better track for that.
Okay.
We did have a prioritized need for this one.
It's not really a grant though, is it? I mean, technically, if you're paying KPMG.
No, I'm sorry. I was saying that that's why we moved it from 102 to 74, not to pay KPMG, to better track it for reporting purposes when KPMG audits us.
Oh, okay.
Sorry about that.
No, that's all right. So is it technically a grant that instead of a contract, the actual vehicle, the acquisition vehicle is changing from contract to grant? And the grants program has a better tracking system?
No, so it still will be a contract, but 74, class line 74 allows us to put just the contracts that are related to subrecipient monitoring, which are more grant-like, but we still use a contract vehicle with the contracts unit. It means that they are providing services on our behalf.
So you know it better than I do, but if you look at it later and you think there's a different word than grant, because I think contracts and grants have different meanings. I just want to keep all the wording transparent for the public to look at.
I totally understand. This is a little bit of a round peg in a square hole. We did request of Department of Administrative Services to create a class line for us specific to track. And they told us that we were not able to add a class line. So we had to select a class line that was most applicable and then explain it. So this is one of those situations. So 74 was not a class line that we typically used. So this allowed us to use that for this purpose.
Thank you.
Okay.
I don't see any other questions.
Rebecca, you did mention that there is a prioritized need here.
Correct. $325,000 for each year.
How much?
$325,000.
Mary Jane has her hand up, Jess.
Go ahead, Representative Wallner.
I was, Chairman, I was just going to let you know that I need to leave at exactly 3 o'clock for a phone call. So I will see you in Durham or in Bedford tomorrow.
I'm sensing we're really close to being done. So enjoy your phone call and we'll see you tomorrow.
Okay,
I'll wave at you in a distance.
Okay, see you tomorrow. Bye-bye.
And what was that prioritized need for? I'm sorry.
It was for the facilitating organization.
Chris, do you want to
Um,
Yeah,
provide?
sure. That it provides support that we talked about earlier in the division overview to assist to increase supports to the family resource centers that provide primary prevention services to families and to really coordinate the services that will focus on the prevention and mitigation of child abuse and neglect and maltreatment, and also expand the kinship navigation program so it can be offered statewide. With the increasing number of parents or grandparents raising grandchildren and family members, there's a huge need for increased kinship support.
So it sounds like that ought to be coming from a domestic and sexual violence account.
I'm not sure.
If you're talking about child abuse, wouldn't,
Well, it's to provide support services so that you're providing parenting education through the family resource centers and home visiting services so that parents can be stronger parents and reduce child maltreatment and the incidence of it so they don't have to become involved with DCYF. So it's a prevention.
okay, but it doesn't, all right. So I don't want to take this down a tangent, but it seems like the domestic and sexual violence accounts also pay for prevention.
But not for children is not my understanding.
I thought that was under domestic, that children are included, that child abuse or abuse between a parent and a child is part of that.
I'm going to defer to Karen and Rebecca on that, but that's not my understanding. And in this division, the only funds we have to assist individuals who have domestic violence are for our shelter programs and to support some of the shelters for people who are fleeing domestic violence.
I don't think I have anything to add. It may be a question that you could ask to Director Ribsum when DCYF presents, as the domestic violence funds are within his budget.
Okay. Will you still be here, Ms. Rounds?
Oh, you get me the whole time. You don't get to get rid of me.
Okay, very
Stuck
good.
with me. All right, so we're down to 7993, which is field eligibility and operations.
This is a relatively big budget, right?
Yes. Yes, this is where those 370 staff live. So
We already talked about trying to come up with a workload benchmark, and is this the one where you said it's hard to do because you guys do an integrated service approach?
Yes. But I will get you the best that we have and the best comparisons.
Can I ask a general question?
Sure.
I've seen this in a number of places under the personal services permanent classified second year. They tend to have a, I don't know, 5 to 6% increase there. Is that just a generalized wage increase?
it would be the step increases. We, as a department, we cannot edit those numbers. Department of Administrative Services provides the numbers, so it has to be because of step increases.
Okay, thank you.
Okay.
All right. The next one is 7214, which is New Heights. And as you heard about yesterday, this is really the staff for New Heights. The contracts for New Heights with Deloitte are within the DOIT budget.
So the permanent, or the positions are down there. You only have 22 for New Heights. Is that
Yes.
right?
Yes.
Total, that's a decrease in
We have
Created
one.
another salaried position? Is that what that is?
It would have been
So
moved
that-
from somewhere else. Go ahead, Rebecca.
Oh, the two unclassifieds were moved into the BFA, the 6125 budget that we saw before.
So the people will still be working on new futures or new heights rather? And this
Yeah,
is
they're
a
in the director's office.
plus up of 1 FTE. What was the basic justification for the 1 FTE increase? Do you know?
Rebecca, do you know where the one classified employee increase came from?
Or the one increase in employees, correct? Not, it was an
Oh,
overall.
it's actually, so we have one position that is an 8T that we're converting to a full-time permanent position. And that's where that one comes from.
For what reason? It's all right. Keep going.
Rebecca, I do have a question about that later. We can connect on
Okay.
it. 7997 is, I believe, the last one in this bureau, which is the disability determination unit on page 987.
So this looks like a pretty big jump in federal funds. If we eliminate what looks to be a COVID jump in 21.
It is a reduction from the 21 budget, though.
That was probably a surge from COVID.
I think it's more just bringing the budget in line with actuals. So the budget fiscal year 21 adjusted authorized was 2.8 million, and we have it down to 2.3, which is more in line with where the actuals were in fiscal year 20.
Okay, that makes a lot more sense. Thank you.
It looks like the consultant budget is significantly less.
Yeah, we actually moved, we had a contract with UMass, and then we had independent medical consultant contracts, and we collapsed it all into the one contract.
Very good. Thank you. No questions.
Right. Okay, then I think that concludes, it does, the accounting units for BFA. Yep, 7997.
Hey, so great job. Thank you. Thank you so much.
Thank
Chris,
you.
I hope you recover.
It was a long day. Hope you guys recover from me as well. So thank you for your questions, your interest, and we will get back to you once we hear back from Kevin.
Okay, so before we say goodbye, does anyone have anything for the good of the committee that they want to say about now?
I have just one, first, thank you, Chris, Rebecca, Mary, all the bureau chiefs that were on in the background. I appreciate it. I also wondered if you would discuss when Tuesday might be moved to today so that I can let the directors know. Scheduling is always difficult with directors, so I just want to make sure.
Talking about March 2nd, right?
Yes, as much notice as possible.
Yeah, so I don't know if Mr. Ripple's had a chance to think through it, but I haven't had a chance to talk to him yet. I just know we need to get it off of the 2nd.
I was wondering if the committee members would consider next Friday a reasonable substitute, Friday the 5th. I'm reluctant to reschedule it to a day when you already have other things scheduled because they have been.
Yeah, no, it should be its own day. DCYF's a big one, so I'm not looking at a calendar. So if you think March 5th is it seems like we have a lot of joint fiscal committees on Fridays. Is that a conflict that you know
That is
of?
not a fiscal committee day.
We don't have fiscal on the 5th now.
Okay. So Representative Nordgren, it looked like you wanted to say something.
No, I think that looks clear for other House business. So that will be fine.
Okay. And then Representative Rogers, did you have a comment? I know Representative Weiler does. Representative Weiler, did you want to say something, sir?
Do we have anything scheduled for Friday, 26th, or Monday?
You don't have anything scheduled for this Friday, although I think HHS has some prior commitments that they have to meet.
I have a county meeting on Friday.
And
I have a meeting Friday as well.
on this coming Monday, you do actually have a Division 3 meeting already scheduled.
Yeah.
We're trying to get off of Tuesday.
Right.
So that's
So I think
why
substituting Friday for Tuesday might be the best idea.
You have a problem with that, sir? That seems to be a consensus building.
You're talking the 5th?
5th, yep.
Yeah, that's good.
And I think Karen, did you want to start at 10:30 instead of 9:30?
I would request that. I'm the department's designee to the Opioid Abatement Advisory Commission that Senator Rosenwald set up for that Friday that starts at 9 o'clock. So I think that I could leave that meeting by 10:30 and be able to be over with you all if that works. I would be very appreciative.
Okay, so just to confirm, we're only doing DCYF on the 5th. Because there was like a two-parter on Tuesday, wasn't there? We were going to finish something off and then hit DCYF.
We did have the Division of Behavioral Health as a two-parter on Monday and Tuesday. So the plan was to start off on Monday with New Hampshire Hospital and Glencliff, and also the Division of Behavioral Health. Karen, do you think we could get through all of those in one day?
I think the potential exists. We probably, I would say that to get through both of those in one day, we probably would need to work past 4 o'clock would be my guess. But we probably could get them done in one day.
Can we do any of them Friday morning just to put a big dent in it or to separate them? Like, I've never gone over the New Hampshire Hospital or Glencliff. Are those really long?
Not typically. New Hampshire Hospital and Glencliff both have quite a few accounting units, but the purpose is all the same, right? It's all operating the facility. So the questions are typically less on those accounting units. But I think that if we started at 10:30 on Friday, if we need to wrap up anything behavioral health, it probably wouldn't take more than an hour. And then we would have the rest of the day for DCYF.
And just to give you a heads up, Jess, on Monday afternoon, I won't be there for a few hours. I have a doctor's appointment.
You also have.
Talking about
I'm
now,
going to
the 1st
defer
or
to
the
you.
8th?
Pardon me?
Which Monday are we talking about? First or
Monday, we're talking about Monday the 1st because we're trying to eliminate the 2nd, and the 2nd had a couple of things going on.
All right,
We're
I'll be a little late to the 1st.
Will be? You'll be late on the 1st? That was a question. I don't know.
Is that for me?
Right.
Yes.
So let's take this offline. I think we have a 90% solution. So if Kevin and Karen, if you would stick around, let's lock this down, and we'll get word out to everyone on what we're going to do.
Sounds good.
Right. So for everyone else, thank you so much. We are adjourned. And you can now have your Corona, Rebecca.
Our Corona on the beach.
Okay, so I was getting a little confused there, and because I still don't have the calendar up in front of me, but the goal is to take March 2nd. It had 2 things going on. DCYF was the big thing. We're going to move that to the 5th, right?
Yes, let me just. There are a couple attendees here. Let me just remove them.
Public. Yeah, we should be out of public at this point.
Yeah, and I don't think I can stop the recording, but I don't think I